The soldier hit the floor before anyone caught him. His body was rigid, jaw locked, fingers curled like claws. And the smell coming off his skin was something no emergency room in Harlow City had ever encountered. The trauma team rushed in with their protocols and their confidence and their medical degrees. They had no idea what they were looking at. But one person did. She was standing in the back of the room, still holding a medication tray, wearing scrubs that had seen better days. And the moment she caught that smell, every muscle in her body went still. Not from fear, from recognition. Because Nurse Lena Marsh had smelled that compound before, in a place she'd spent 6 years trying to forget. Before this story goes any further, if you've never been here before, hit that subscribe button right now, because this channel is where stories like this live. The kind that keep you up at night, that make you forget you were supposed to go to bed an hour ago. Drop a like if you're already hooked, and tell me in the comments, what city, what country are you watching from tonight? I want to see exactly how far this story travels. Now, let's go back to the beginning. The call came in at 11:47 p.m. Harlow City General Hospital had seen bad nights before. It sat at the edge of a city that never fully decided whether it wanted to be industrial or residential. And the result was a neighborhood that was both grimy in some blocks, quietly functional in others, with a hospital that handled everything from factory accidents to overdoses to the occasional stabbing. The ER staff were used to chaos. They were used to bodies that arrived in bad shape and got worse before they got better. But the man who came through the ambulance bay doors that night was something different. Lena Marsh noticed it before the paramedics finished their handoff report. She was restocking a supply cart near Bay 3 when the gurney came through, and she had maybe 4 seconds of clear visual before the trauma team closed in around the patient. That was enough. The man was mid-40s, solidly built, wearing civilian clothes that had been cut away, dark cargo pants, the remains of a thermal base layer. His arms were restrained with soft cuffs, not because he'd been violent, but because his muscles were spasming in long, rolling contractions that made it look like something was moving under his skin. His face was wet with sweat. His eyes were open, but not tracking anything. And the smell. It was faint, buried under the sharper chemical odors of antiseptic and the rubber of the ambulance interior still clinging to the gurney sheets. But it was there. Something metallic, something organic underneath the metal. A combination that shouldn't occur naturally, that didn't belong in a hospital, that Lena's nervous system cataloged in the span of one breath and immediately flagged as a threat she had not encountered in 7 years. She set down the supply cart. The paramedic doing the verbal handoff was a young guy named Torres, one of the regulars who ran the East Side routes. He was reading off his tablet in the practiced monotone of someone who'd done 1,000 of these. Male, approximate age 45, unknown identity, found unresponsive in the parking structure on Meridian and 14th. Bystander called it in. No wallet, no phone, no ID. Onset of symptoms unclear. Witnesses reported he was standing at his vehicle and then just went down. GCS on scene was 7, dropped to 5 in transport. We've got irregular pupils, sustained muscular contractions, excessive salivation, suspected OD. Dr. Preston Halk was already pulling gloves on, scanning the monitors being attached to the patient's chest. That was our first read, yeah. Could be a stimulant combination, possibly PCP given the muscle involvement. Tox panel, Halke said to the room without looking up. Get me a line in. What's his pressure? 84/50 and dropping. Halke moved with the ease of someone who had been chief of the trauma division long enough to stop being surprised by anything. He was tall, efficient, and possessed the particular brand of authority that came from decades of being the most credentialed person in the room. He did not consult. He directed. Lena moved closer to the gurney, staying to the outside edge of the cluster of bodies, keeping herself positioned where she could see the patient's face without being in anyone's way. She was good at that. She had spent 3 years at Harlow City General, cultivating a kind of practiced invisibility, showing up where she was needed, completing tasks without narration, slipping out of spaces before anyone thought to acknowledge her presence. It was partly professional habit and partly something older, something built into her over years that she rarely examined directly. She looked at the patient's hands. The spasms were following a pattern, not the random firing of a stimulant overdose, not the tonic-clonic rhythm of a seizure disorder. The contractions moved through the muscle groups in a sequence, proximal to distal, starting at the shoulder, traveling down the arm, reaching the fingers and then releasing, cycling again. She had seen that pattern in a training environment, in a room full of people in protective gear, watching video documentation of exposure effects. She had seen it once in the field, on a forward operating base in a country she was not supposed to be in, when an intelligence asset arrived in bad shape, and the team medic had 40 minutes to keep him alive before medevac. She hadn't been the team medic. She'd been something else. "Excuse me." She said it to the nurse beside her, Yolanda, who was preparing a line kit, and edged forward another foot. "You need something, Lena?" Yolanda asked without looking up. "Just watching the presentation. Little crowded for spectators." "I know." She watched the patient's jaw. The masseter muscle along his cheekbone was locked so tight she could see the ridge of it from where she stood. His saliva was thickening. She could see it at the corner of his mouth, not the watery foam of a seizure, but something denser, like his secretory glands were being forced into overdrive. His pupils, when she got a clear angle on his face, were pinpoint, both of them, symmetrical. Organophosphate, or something built from the same chemical architecture, not a recreational drug, not a combination overdose. This man had been exposed to a compound from a category of substances that did not appear in standard toxicology panels, that did not respond to the treatment pathways Dr. Halka was currently ordering, and that would continue to destroy his nervous system from the inside until either someone administered the correct antidote sequence or he died on the table. Lena looked at the clock on the wall. She calculated. Then she said, loud enough to carry across the bay, "He needs atropine and pralidoxime." The room did not stop. Nobody looked at her. She said it again, more directly. "Dr. Halke, the muscular pattern and the secretion profile don't fit a stimulant OD. I think this is organophosphate exposure. He needs atropine to start and then pralidoxime to reactivate the cholinesterase before—" "Lena," Halke's voice was flat. He didn't look up from the patient's chart on the tablet. "I appreciate the input. Stick to your assignment." "I understand, but the presentation is consistent with a complicated polysubstance case, which I've managed before you were licensed." He finally glanced over at her. His expression wasn't angry. That would have been easier to work with. It was dismissive in the specific way that communicated she had already been assessed, filed, and found not worth sustained attention. "What's your current assignment?" She held her ground for 2 more seconds. "Medication prep, Bay 2. "Then I'd suggest you get back to it." The team around the gurney had maintained their focus throughout this exchange, with the practiced discipline of people who knew better than to acknowledge a subordinate challenging the attending. Yolanda had not looked up once. Torres, still lingering near the bay entrance to finish his paperwork, had found something very interesting to study on his tablet. Lena stepped back. She went to Bay 2. She prepared medications, but she kept watching through the glass partition that separated the bays, and what she watched was the patient's condition, and what she tracked was time. Halke had been chief of trauma at Harlow City General for 11 years. Before that, he'd done his residency at a teaching hospital in Boston and his fellowship in critical care at a program that was moderately prestigious and that he mentioned more than was strictly necessary. He was not a bad physician. He was thorough on the conditions he knew well, aggressive with fluids and stabilization, good at managing his team's workflow under pressure. He had never, in 11 years, treated an organophosphate poisoning more complex than an agricultural accident involving a farm worker who'd absorbed pesticide through prolonged skin contact. That was a common enough presentation that the protocol was standardized, and the antidote administration was practically routine. What the man on the gurney in Bay 3 had been exposed to was not a pesticide. Lena didn't know the exact compound. She couldn't know without a specialized analysis that Harlow City General's lab was not equipped to run. But the delivery mechanism and symptom profile suggested something engineered, something derived from the same chemical family but modified for potency and speed of onset. The kind of compound that appeared in classified threat briefings, not in agricultural safety training. She watched Halke order a lorazepam push for the muscle spasms. She closed her eyes for a moment. Benzodiazepines would suppress the visible contractions without addressing the underlying mechanism. The patient would appear more stable. His numbers would briefly improve. And then the compound would continue breaking down his acetylcholinesterase, and the muscles that actually kept him alive, his diaphragm, his heart, would begin to fail with less visible warning. She went back to her medication prep. She measured and labeled. She moved through the task with the muscle memory of someone who'd done it 10,000 times, and the quieter part of her mind that had been running calculations since the gurney came through the door kept working. She needed to know if she was right. She went to the supply room on the pretense of restocking and pulled up the patient's chart on the terminal there. Technically, she had access. She was a licensed RN assigned to the trauma floor. She pulled his vitals trend, his lab orders, the initial physical exam notes Halke had dictated. Pupils, 2 millimeters bilateral. That was in there. Halke had noted it and attributed it to narcotics. Secretory hyperstimulation, noted under excessive salivation, possible aspiration risk. Treatment, suction and positioning. The tox panel was ordered, standard panel. It would come back negative for everything that mattered, and Halke would treat that negative result as confirmation of his working theory instead of as a gap in the testing. Lena stood in the supply room for 30 seconds and made a decision she already knew she was going to make. She went back to Bay 3. "I need to speak with you," she said. Halke was reviewing the lorazepam response. The patient's visible spasms had reduced, which Halke was apparently reading as improvement. He didn't turn around. "I'm a little busy, Lena. The atropine, I need you to at least consider, we've been through this." He turned now, and his expression had graduated from dismissive to something with an edge to it. He was a tall man, and he used the height unconsciously, squaring toward her in a way that was probably habit. "I don't know what made you decide tonight was a good night to become a pharmacologist, but the decision-making in this bay is mine, not yours. That's not a critique of your skills. It's a description of how medicine is organized. Do you understand me?" She was aware of 2 nurses and a resident watching this exchange from their periphery. "His pressure is dropping again," she said. "The lorazepam reduced the visible symptoms, but it hasn't changed the underlying mechanism. If this is what I think it is, his cardiac and respiratory muscles are next. You have maybe," she calculated, 15 minutes before this becomes a code. His pressure dropped because he's been hypotensive since arrival. We're managing his volume. And if I'm right, managing his volume won't be enough." Halke looked at her for a long moment, the kind of look that wasn't really looking, that was deciding something about her unrelated to the argument she was making. "You're a good nurse," he said, which meant something different from what the word said. "You show up, you do your job, you don't cause problems, don't start causing problems now." He turned back to the patient. Behind her, she heard one of the nurses, she thought it was Dwayne, the male RN from nights, make a small sound that could have been agreement or could have been discomfort. She didn't turn to check. She stood at the edge of the bay for 5 more seconds. Then she went to the medication room, pulled atropine sulfate from the controlled stock, which she had access to, which was within her preparation authority even if administration required a physician order, and prepared a syringe. She documented the pull in the system. She noted the time. She wrote her own name clearly in the record. She went back to Bay 3. "I'm going to need you to leave," Halke said the moment he saw what she was carrying. "I need you to look at his pressure curve." She held up the tablet she'd pulled from the station. In the last 8 minutes, it's dropped 14 points. His heart rate is compensating, but it's going to fail to compensate. This is the progression. Put that syringe down. I'm not going to give it without your order. I'm asking you to look at security. The word fell into the room like something heavy. For 1 beat, nothing moved. Then Halke said it again, louder, turning toward the nursing station. "Can I get security in Bay 3? Lena set the syringe down on the tray beside the gurney, within arm's reach of the patient. She stood there. The patient's monitor began alarming. A sustained, climbing tone that the room recognized as a pressure alert. Halk turned back to the screen. The number was 61/30. "He's crashing," the resident said, and the flat observation kicked the bay into motion. Lena stepped forward and picked up the syringe. "Get away from him." Hulk's voice had a different quality now, still authoritative, but with something underneath it that might have been the first note of uncertainty. "His acetylcholinesterase is being inhibited," Lena said. She was not shouting, she was not performing. Her voice had dropped to something level and deliberate that was different from her normal register, different enough that Yolanda, across the room, looked up sharply. "Atropine blocks the muscarinic receptors and buys time. Without it, his diaphragm will seize and he will stop breathing. You can have security remove me after." The monitor alarm climbed another pitch. Halky looked at the screen, looked at her, looked at the syringe. If I'm wrong, the atropine won't hurt him, and you can document that I acted without authorization and do whatever you need to do." She held his gaze. "If I'm right, you have about 90 seconds. 3 seconds of silence that felt much longer. "Give it," Hulk said. She administered the atropine. The room waited. The monitor alarm held its pitch for 8 seconds. 10, 12, then the pressure reading shifted. 68, 71, 76. The patient's jaw, which had been locked solid, released. His breath, which had been getting shallower by the minute, pulled in deeper. Still labored, still wrong, but deeper. Nobody in the bay said anything. Lena set the empty syringe down and said quietly, "He needs pralidoxime now and a full decontamination protocol. Whoever brought him in should not have direct contact with his clothing or skin without level B protection at minimum. And—" She paused, because the next thing she was going to say was going to sound like something else entirely. "Someone needs to call the CDC emergency line." Hulk stared at her. "This isn't a drug overdose," she said. "Whatever is in his system was put there deliberately, and it didn't come from anything your tox panel is going to find." The security officer arrived in the doorway at that moment, a heavy-set man named Gilbert, who'd been walking the floor for years and had the expression of someone who'd been told to handle something without being told what something was. Halky looked at Gilbert, looked at Lena. "Stand down," he told Gilbert. His voice was careful. Gilbert retreated. Halka turned back to the patient, and his expression had the particular quality of a man reassembling his understanding of a situation in real time, which was not a comfortable thing to witness. "Who are you?" he asked, and the question wasn't hostile. It was something more unnerving than hostile. Lena pulled off her gloves. "Lena Marsh," she said. "ER nurse, 3 years, this floor." He kept looking at her. "That's not what I asked," he said. She didn't answer. Instead, she turned toward the nursing station and picked up the landline, the direct dial unit that bypassed the hospital switchboard, and began to dial a number from memory. 11 digits, a sequence she had not dialed in 7 years, that she had been fairly confident she would never dial again. It rang twice. A voice answered, not a greeting, just silence with a specific quality. "This is Marsh," she said. "I have a compromised asset and a potential release event. Harlow City General, Trauma Bay 3. I need a chemical threat team and a federal liaison, and I need them in under 2 hours. She paused, listening. "No, I'm not back. This is a one-time call. Send whoever you need to send, but this—" She stopped, lowered her voice slightly. "This is not a civilian exposure. Someone brought this to a civilian hospital, and I need you to understand what that means for containment." She hung up. The trauma bay was very quiet. Yolanda was standing completely still with a blood pressure cuff in her hand. The resident had stopped typing. Halky had not moved. Lena looked at the patient on the gurney, at the man who had arrived with no name and no explanation, whose body was still fighting a compound it had no natural defense against, who had been found in a parking structure and transported by paramedics who thought they were handling an overdose. His eyes had begun to track. Weakly, inconsistently, but they were moving. At some point in the last 2 minutes, some basic level of consciousness had reasserted itself. He was looking at her. His lips moved. She leaned closer. What he said was barely sound. She had to be within a foot of his mouth to read it, and what she read stopped her. 2 words. A location. She straightened up slowly. Whatever had happened to this man was not the end of the event. It was the beginning of it. The thing he had just told her, the place he had named with what might have been the last breath he had enough control to direct, meant that there was something else in this city, somewhere she now knew about, that was still active. She looked at the clock. Then she looked at the door. The hospital around her continued its ordinary night. Phones ringing, gurneys moving, the sound of someone crying in a curtained bay at the far end. And Lena Marsh stood in the center of it and felt, with complete clarity, the thing she had spent 7 years trying to leave behind, settling back into place around her like it had never been gone. The location he had named was Vantage Station. Lena knew it. Everyone in Harlow City knew it. A transit hub on the north end of downtown, 4 subway lines converging under a single roof, close to 80,000 people moving through it on a weekday. She'd taken the Green Line from there twice a week for the first year she worked at the hospital, before she moved close enough to walk. She knew the layout of the main concourse, the lower platform levels, the maintenance corridors that ran beneath the ticketing floor. She knew it the way anyone who lived in a city knew the places they passed through regularly, not in detail, just in the comfortable blur of a familiar space. What the man on the gurney had told her reordered that familiarity into something sharp and cold. She did not say the name out loud. Not yet. She turned away from the gurney and pulled out her phone and typed it into a message draft she didn't send because she needed to see it written down, needed her own brain to confirm she'd heard correctly through the wreckage of his voice. Vantage Station. 2 words. She stared at them for 3 seconds and then deleted the draft. "Lena," Halka's voice. She turned. He was standing beside the patient's gurney with his arms crossed, and whatever professional authority he'd been performing for the last hour had shifted into something that looked more like a man who just realized the floor under him was less solid than he'd assumed. The patient's vitals were stabilizing, slowly, imperfectly, with the particular reluctance of a body that had been badly damaged and was not finished deciding which direction it was going, but stabilizing. "You need to tell me what's happening," Halki said. "I told you what I know. You told me to call the CDC, and you made a phone call you won't explain. That's not the same thing. The CDC call is the right move regardless of anything else. Whoever transported this patient came into contact with a compound that doesn't belong in a civilian setting. Your decontamination protocols need to go up to level B, your paramedic team needs to be isolated and evaluated, and this bay needs to be sealed until someone with the right equipment can assess secondary exposure risk." She said it evenly, watching his face process each point. Those aren't opinions. Those are standard responses to an unknown chemical agent in an open medical setting. "And the phone call." She looked at him. "I reached out to people who can send the right kind of help." "What kind of help specifically?" "The kind that carries the equipment your hospital doesn't have." Hulk uncrossed his arms. He had the look of a man who wanted to push back on principle, but couldn't find the specific lever to push. "I'm the chief of this division. I need to know what I'm dealing with. Right now you're dealing with a patient who needs continuous atropine titration and close monitoring for respiratory depression. The pralidoxime needs to be running. His secretions need to be suctioned every 10 to 15 minutes because his glands are still overstimulating." She watched him. "Do you want to manage his immediate care, or do you want to have this conversation? Because I can't do both for you." That landed somewhere uncomfortable. She watched it land. Hulk turned back to the patient and began issuing orders to the resident. His voice had the compressed quality of someone who'd made a decision to be functional first and angry later. Lena moved to the nursing station and pulled up the hospital's emergency contact tree on the terminal. She needed the administrator on call. Not for permission, she was past the point where permission was the operating framework, but because what she was about to do would involve the hospital's physical spaces, and the administrator on call had keys and access codes that she didn't. The on-call admin was a woman named Patricia Osai, who answered on the 4th ring with the voice of someone who'd been asleep. "This is Marsh, ER trauma floor. I need you on site. I have a potential chemical contamination event, and I'm expecting federal response within the next 90 minutes. I need building access, and I need your security team briefed." Silence on the line. "Marsh," Osei said slowly, "you're a floor nurse." "I am, And the federal response team I just called is going to need a point of contact when they arrive, and that contact needs to be administrative. I'd rather it be you than someone who shows up unprepared." She paused. "I can explain more when you get here. Please get here." She hung up before Osei could decide whether to argue. Well, the next 40 minutes were the kind that didn't feel like 40 minutes. They felt like something compressed and elastic, stretching and snapping back, with the clock on the wall moving at a pace that didn't match the density of what was happening inside it. Lena managed the patient's care with Halka, which meant she did the detailed work, and Hulk stood close enough to maintain the fiction of oversight. She didn't resent it. She needed him functional, not humbled. The patient, she'd started thinking of him as the asset, the old terminology surfacing without invitation, responded to the atropine titration the way she'd hoped, which was imperfectly. His pressure stabilized but didn't normalize. His respiratory effort improved but remained effortful. He was conscious in the technical sense, eyes open, some motor response, but he hadn't spoken again, and she didn't push him. Whatever he'd used his last available voice to tell her, he'd calculated it was worth the effort. She wasn't going to ask him to spend more. Yolanda came to stand beside her while she was adjusting the drip rate. "You want to tell me what's going on?" Yolanda said, in the tone that wasn't really a question. "Complicated night." "Lena, I've worked with you for 3 years, and I have never heard you talk to Hulk like that." "Like what?" "Like you expected him to listen." Lena checked the drip, made a small adjustment, watched the flow. "He did listen. Eventually. After you made a phone call that made you sound like someone from a movie." Yolanda's voice was careful, not unkind. She'd been a nurse for 19 years and had the quality of someone who'd stopped being surprised by people, but hadn't stopped being curious about them. "The number you called, you dialed it from memory." "Yolanda, I'm not asking for the story. I'm asking if we're safe." Lena looked at her. "Right now, this bay is the safest place in this building because we know what we're dealing with. Keep your gloves on, keep your face away from the patient's secretions. Don't touch anything that came in with him without level B gear. If you do those things, you're fine." "And outside this bay?" Lena didn't answer immediately. "Get the other nurses briefed," she said. "Mikatit, nothing detailed, just the protective protocols. Say it's a precaution." Yolanda looked at her for a moment. Then she nodded and walked away. And Lena watched her go and thought that in another version of her life she might have told her the rest of it. And that the reason she didn't wasn't distrust, but something more structural than that. The habit of containing information to the people who needed it, parceled out in exactly the amounts they needed to function, not more. It was a habit that had kept people alive in other contexts. She wasn't sure, standing in a hospital ER at midnight, whether it was still the right tool or just the familiar one. She pushed the thought aside. There wasn't time for it. She needed to get to Vantage Station before whoever she'd called got there and made decisions without her. The problem was she couldn't leave. Not because anyone was physically stopping her, but because leaving meant walking away from a patient whose condition was still precarious, in a facility whose staff didn't yet understand what they were managing, with a response team inbound whose personnel she hadn't interfaced with in 7 years, and who had arrived to a situation that was half-managed at best. Leaving was the thing her body wanted to do, because some dormant part of her was already running the Vantage Station problem through tactical frameworks, and building a picture of what needed to happen there, and that part had a very clear opinion about how much time they had. Staying was what the situation required. She compromised, which was something she was better at than most people assumed. She found a supply room with a window, pulled out her personal phone, and sent a text to a number that was not in her contacts. She'd memorized it because she'd been trained to carry critical information in her head and not on devices. A number that belonged to a man she'd worked alongside in circumstances she rarely thought about. The text said, "Vantage Station North End, downtown Harlow City." Unknown timeline, but asset indicated active placement. Passed to whoever is running the ground team. She stared at the message for 2 seconds, then sent it. Her phone showed delivered. No read receipt. She went back to the floor. Hulke was at the nursing station, on the phone with the hospital administrator who had apparently arrived faster than expected. Lena could hear his end of the conversation through the ambient noise. Clipped, precise. The version of himself he deployed when talking to people with institutional authority. She caught words. chemical protocol, federal notification, isolation procedure. He was doing the right things. She noted that without giving it more weight than it deserved. She checked the patient. His pressure was holding at 88/60, which was not good but was not deteriorating. His pupils had dilated slightly from the atropine, which was the correct pharmacological response, and meant the drug was doing what it needed to do. His breathing was labored but self-sustaining. She adjusted his positioning, cleared his airway, noted the time. Then the ER doors opened, and the night changed again. She heard them before she saw them. A sound that didn't belong to the hospital's normal register. Something in the purposeful quality of multiple sets of footsteps moving fast without running, the particular cadence of people who'd been trained to enter spaces quickly without announcing urgency. She turned toward the ambulance bay entrance. 4 people. 3 in dark tactical gear with no visible agency markings, and 1 in a suit that was wrong for the hour. A woman, maybe 50, with the kind of stillness that wasn't calm but was discipline. The difference between someone who wasn't afraid and someone who'd learned to work through fear so thoroughly it no longer showed. Behind them, through the glass doors, she could see 2 vehicles that were not ambulances parked in the bay. They were fast, but the response team she'd called should not have been this fast. The woman in the suit swept the room once with a look that categorized everything she saw at a speed that was professionally familiar to Lena, and then she locked onto Lena with the specific focus of someone who'd already been told who to find. "Marsh," she said. Lena hadn't moved from beside the gurney. "Who are you?" "Special Agent Diane Farrow, Federal Chemical Threat Unit." She produced identification, not a credential wallet, but an actual physical document with a laminated seal that Lena's eyes processed in the fraction of a second before Farrow tucked it away. "Your call was routed to our field office. We've been on standby in this region for 11 days. 11 days? That was information. "The patient," Lena said, "is stable for now. Modified ATNAA protocol, atropine titration ongoing. He needs pralidoxime continued in close respiratory monitoring. He's conscious, but not communicative." She paused. He said something before he lost the ability to speak clearly. Farrow's attention sharpened. "What did he say?" "I need to know who he is first." The tactical team around Farrow had fanned out slightly. Not aggressively, but occupying space in the way trained people did automatically, creating a perimeter that wasn't a perimeter. One of them, a man with a close-cropped beard and the build of someone who did a lot of weight-bearing work, had positioned himself between the gurney and the bay entrance without making it look intentional. "He's a federal contractor," Farrow said, Raymond Kessler. "He's been embedded in a procurement network for 9 months. We lost contact with him 4 days ago." 4 days, Lena said. "He surfaced tonight. Whatever happened to him in those 4 days?" Farrow looked at Kessler on the gurney. "You can see." Lena looked at Kessler too, at the gray of his face, at the way his chest worked for every breath like it owed him something. 4 days of exposure or repeated dosing. The compound had had time to accumulate. "He named a location," she said. "Vantage Station." Farrow went still in the specific way that confirmed the name meant something to her. "He said it deliberately," Lena continued. "He was barely functional, but he prioritized that over anything else. Whatever the situation is at Vantage Station, he considered it the most important thing to communicate." "When did he say this?" 48 minutes ago." Farrow turned to the man with the beard, and something passed between them that wasn't a look so much as an agreement. He was already moving toward the door. She turned back to Lena. "The compound he was exposed to," Farrow said. "Your assessment. Organophosphate derivative. Modified. Not agricultural. Designed for a specific effect profile. Sustained incapacitation without immediate lethality. Whoever made it wanted the target alive and non-functional." She watched Farrow process this. "It's not something Harlow City General's lab can identify. You need a CBRN field kit." "We brought one." Farrow looked at her with an expression that was not quite appraisal and not quite recognition. "Your call said potential release event. What's your basis for that?" Kessler was a contractor embedded in a procurement network. Someone got to him and dosed him, and then put him where he'd be found, dropped him in a public parking structure and let the system move him to a hospital. That's not an assassination. That's a delivery method. A delivery method for what? For the information he carried. The location. Lena kept her voice level. They wanted him to talk. They made him sick enough to be desperate, functional enough to communicate, and they aimed him at the most likely point of contact. They knew a hospital would receive him. They knew someone might listen. The question is whether Kessler told them what he was going to tell me, or whether he held it back long enough to get here. Farrow was quiet for 3 seconds. If he held it back, Farrow said slowly, then whatever is at Vantage Station is still uncompromised. And if he didn't, then we're already behind. The two of them stood on opposite sides of the gurney with that fact between them. And Lena watched Farrow make the decision that Lena had already made 40 minutes ago and had been waiting for someone with operational authority to make officially. I need you on the ground team, Farrow said. I'm a nurse, Lena said. You identified a modified organophosphate on presentation, administered the correct antidote protocol without physician authorization, and correctly assessed the intelligence value of a compromised asset's final communication. In my experience, that's not a nursing skill set. I've been out for 7 years. I know. Farrow's voice was even. I read your file on the drive here. That was uncomfortable in a specific way. Then you know why I'm out. I know what the file says. Farrow looked at her directly. The decision about whether you come is yours. I'm not going to put you in the field against your will, but I need someone who understands the compound, and right now, you're the only person in this building who does. Halki appeared in the bay entrance. He'd finished his call and had clearly walked in on enough to recalibrate his understanding of the night for the second time in an hour. He looked at Farrow, at the tactical gear, at Lena, and his face did the thing faces did when the architecture of a situation turned out to be different from what was assumed. Who authorized federal agents in my ER? He said, but the authority in his voice had the quality of habit rather than confidence. Dr. Halk. Lena turned to him. The federal team is taking primary responsibility for the patient's situation. I need you to keep his atropine running, suction every 15 minutes. Call me immediately if his respiratory effort decreases. She paused. You've done the hard part. The protocol's working. Trust it. Halk looked at her. Something in his expression wanted to reinstate the hierarchy that the last 2 hours had steadily dismantled. She watched it try and fail. You're leaving, he said. I need to be somewhere else. This is your patient. He's your patient now, she said. You know how to manage him. I showed you. A beat. You can do this. She said it without irony and without cruelty, and she meant it in the specific way of someone who'd spent a long time working alongside people who needed to be reminded of their own competence at the moments it mattered most. Halki absorbed it in silence. She picked up her jacket from the hook behind the nursing station. The van Farrow's team had arrived in was dark blue, unmarked, with blackout rear windows and equipment cases bolted to the interior walls. Lena got in the back without asking what was in the cases. She already had a working hypothesis. Farrow sat across from her. The bearded man, she'd learned his name was Soto, was in the passenger seat with a radio. 2 more agents occupied the space around the equipment cases. You said you've been on standby in this region for 11 days, Lena said, as the vehicle moved out of the hospital bay. Correct. That predates Kessler's disappearance. It does. So you were tracking something before he went dark. Farrow looked at her steadily. We had indicators. Financial movement through the procurement network he was embedded in. Unusual acquisition patterns. Materials consistent with delivery system components. What kind of delivery system? The kind that works in an enclosed space with high pedestrian volume. Lena looked out the blackout window at nothing. The city at 1 a.m., visible only in the gaps where the window wasn't fully opaque. Streetlights, a convenience store still lit. The underside of the elevated train structure they were passing beneath. Vantage Station has 4 lines, she said. The main concourse is above grade. The platform levels go down 3 stories. If you wanted maximum exposure in an enclosed environment, you'd target the lower platforms during peak hours. We know, Soto said from the front, but it's 1 a.m. The station runs reduced service until 5 a.m. Maintenance crews work the overnight. She calculated. Maintenance crews meant maybe 40, 60 people across the whole facility at this hour. But a device planted tonight would still be active at 7 a.m., when the first rush hour commuters filled those platforms to capacity. That was the math. Plant it clean, let the overnight hours serve as buffer, activate it when the numbers justified the risk. "How much time do we have, Ji-san?" she asked. "If Kessler's information is current," Farrow said, "the device is already in place. We have a window before the maintenance window closes and the facility transitions to morning operations." "That's 3.5 hours, roughly." The van turned north. Lena looked at her hands. No gloves now. She became aware, in the way you became aware of things when the immediate crisis pressure briefly lifted, that she'd been wearing hospital gloves for the last 2 hours, and her hands felt strange without them, exposed in a way that was partly physical and partly not. "I need to know everything you have on the device type," she said. "Materials, likely configuration, what your indicators suggested about delivery mechanism." Farrow opened one of the equipment cases and pulled out a tablet. She handed it across. The screen showed a procurement file, acquisition records, shipping manifests, the kind of document that looked like nothing until you knew the specific compounds being purchased and cross-referenced them with delivery system applications. Lena scanned it fast, the way she'd been trained to read intelligence documents, not linearly but structurally, pulling the load-bearing pieces. What she saw made her stomach do something that wasn't fear exactly, but was adjacent to it. "This isn't a single device," she said. Farrow said nothing, which was confirmation. "How many?" "Current assessment is 3, possibly 4. "And you have a location on any of them?" "One confirmed. 2 probable based on architectural mapping of the facility." Lena looked at the tablet, looked at the schematic of Vantage Station's underground infrastructure, the platform levels, the ventilation corridors, the maintenance access points that honeycombed the structure below the concourse. She oriented herself within the schematic the way she'd learned to orient within any physical space, not just where things were, but where they connected, where air moved, where people moved, where the system had its vulnerabilities. She found something that Farrow's team hadn't marked. Her finger moved to a point on the schematic, a maintenance corridor junction that intersected 2 of the ventilation pathways, positioned in a way that, if you understood how the compound behaved in a dispersed state, would be a more effective placement point than any of the 3 marked locations, more effective by a significant margin. "There," she said. Farrow leaned across and looked. "That's not on our list," Farrow said. "It should be." Soto turned from the front seat. He'd been listening to the radio with one ear and the van's interior with the other. His expression was careful. "How do you know that?" Lena thought about how to explain it in a way that didn't take more time than they had. "The compound disperses with airflow. That corridor is the confluence point for 2 of the station's 4 ventilation systems. A device placed there doesn't just affect one platform level. It affects everything those 2 systems feed. Upper platforms, main concourse level, the ticketing hall." She looked at Farrow. "If I were building this system for maximum effect with minimum number of devices, that would be the priority placement." Farrow and Soto exchanged a look. "We're going to need you inside," Farrow said. It was not a question this time. The van was moving through an intersection Lena recognized, 6 blocks from Vantage Station, the grid of streets around it starting to clarify through the gaps in the window. The city looked ordinary in that hour, the way cities did when the daytime population had gone home and left the infrastructure to run itself. "I need to know something first," Lena said. Farrow waited. The procurement network Kessler was embedded in. Who was running the acquisition on the Harlow City end? A pause. In the pause, Lena heard something that wasn't hesitation, but was its functional equivalent, the half-second a person took when they were deciding how much of a thing to say. "We have a name," Farrow said. "We haven't been able to act on it because we didn't have physical evidence linking them to the materials." "Who?" Another pause. Soto had turned fully in his seat now, watching Lena with an expression she couldn't fully read in the van's dim interior. Farrow said, "The network's local point of contact used a medical professional's credentials to move some of the acquisition paperwork. Specifically, a physician with administrative access to institutional procurement systems." Lena went very still. A physician. She thought about the way Halke had looked at her across the gurney in Bay 3, the complicated architecture of his expression in the moment she'd told him she needed to be somewhere else. She thought about the 11 days Pharaoh's team had been on standby, which predated Kessler's disappearance, which meant the indicators they'd been tracking had been active while she was running her ordinary shifts in the ordinary ER. She thought about all the nights she'd worked that floor without noticing anything, which was not the same as thinking nothing had been there to notice. "Hulky," she said. Pharaoh's silence confirmed it before her words did. "We think so," she said. "We don't have enough for an arrest, but we have enough to believe he knew about the Vantage Station operation." The van stopped at a light. Through the gap in the window, Lena could see the northern edge of the transit hub's roof structure, the glass and steel canopy that covered the main concourse entrance, lit by the amber of the city's overnight lighting. She looked at it. She thought about Kessler on the gurney and the careful, deliberate effort it had taken to produce those two words from a body that was barely working. And she thought about Hulk standing in the bay entrance watching her leave with the expression of a man who had just made an assessment. Then she thought about the fact that she had just left Kessler in Hulk's care. "Stop the van," she said. Pharaoh looked at her sharply. "We're 6 blocks from—" "Stop the van." Her voice had a different quality now. Not louder, but denser, the way pressure changed to sound. "Kessler is the only person who can corroborate what you have on Hulk. He's the one surviving contact from the embedded network. If Hulky knows what Kessler told me and he understands what that means—" She stopped because Pharaoh was already moving, already reaching for her radio, already speaking in the clipped shorthand of someone who'd arrived at the same place and was acting on it simultaneously. But Lena was already pulling out her own phone. She called the nursing station at Harlow City General. It rang 4 times. She counted them. 5. Yolanda picked up. "It's Marsh. Where is Hulk?" He was... A pause, fabric rustling, the ambient sound of the floor. "He was at the station 5 minutes ago. Lena, what? Is he there now?" Another pause. Longer. I'm not seeing him. He might be in the bay with the patient. Go check. Right now." She heard Yolanda's footsteps on the line, quick and then quicker, and the sound of the bay door, and then 3 seconds of silence that felt like something structural collapsing. And then Yolanda's voice came back without the professional steadiness it usually carried. "The patient's here," she said. "The patient's fine. His numbers are okay. But Lena—" "What?" "Someone disconnected the atropine drip. It's not running. And the pralidoxime bag is—" Yolanda's voice dropped to something that wasn't quite a whisper. "It's been replaced. This isn't the bag we set up. The labeling is wrong." The van had stopped. Lena was already reaching for the door handle. "Yolanda, listen to me," Lena said. "Don't touch the bag. Don't let anyone near the line. Put on gloves and disconnect the IV access point at the catheter. Not at the bag, at the patient's arm, and flush with normal saline only. Do you have saline at the station?" Yes, we have it." "Do it now. Keep the phone with you." She heard Yolanda moving, heard the controlled panic of someone who was scared and functioning anyway, which was the best you could ask for. Lena had the van door open and 1 foot on the pavement before Pharaoh caught her arm. "My people can go back." "Your people don't know his current status or what a substituted bag might contain." She looked at Pharaoh directly. "I'm 7 minutes from the hospital. You go to Vantage Station. I'll follow when Kessler is stable." "We need you at the station." "You need Kessler alive more. He's your corroboration on Halka and every connection in that procurement network." She pulled her arm free, not roughly, but with finality. "I'll get there." Pharaoh held her gaze for 2 seconds. Then she said to Soto, "Give her a radio." Soto pulled a compact unit from the equipment case and handed it across. Lena took it, confirmed the channel, clipped it to her jacket pocket, and was moving before the van door finished closing behind her. She covered the 6 blocks at a run that wasn't quite a sprint, the kind of sustained pace she'd maintained on field exercises in conditions worse than a clear night on empty sidewalks, and which her body remembered imperfectly, but remembered. Her knee complained at the 3rd block. She ignored it. The city at this hour was almost entirely absent of pedestrians, and the few she passed barely registered her. A woman in scrubs running at 1 a.m. was easy to file under medical emergency and not think about further. She pushed through the ER entrance and was in the trauma hallway before the automatic doors had finished their cycle. Yolanda was in Bay 3, gloved, crouched beside the IV pole, and the expression on her face when she saw Lena come through the door was something that had relief and fear in equal measure. "I disconnected at the catheter," Yolanda said immediately. "Flushed with 50 of normal saline. His pressure has been steady, 86 over 62. Lena was already at the bedside, pulling gloves from the box on the wall, assessing Kessler with the fast, systematic pass of someone who'd done trauma assessments in circumstances where taking more than 30 seconds meant someone died. Color: gray, but not worse than before. Respiratory effort: maintained, still labored. Pupils: she pulled a pen light, checked both sides. Still small, still reactive. The atropine was metabolizing, but it hadn't fully cleared. She looked at the substituted IV bag. It was labeled pralidoxim, 1 gram in 100 milliliters normal saline, with a handwritten lot number that didn't match any format Harlow City General's pharmacy used. She knew that because she'd prepared enough of those bags herself over 3 years to recognize the label template. Whoever had done this had been competent enough to substitute a bag that looked correct at a glance, but hadn't known the specific labeling format, which meant they'd worked fast, under pressure, with materials prepared in advance but not specifically matched to this facility. Planned but improvised in execution. She didn't open the bag. She set it aside carefully, treating it as a contaminated substance, which it almost certainly was. "Where's Halki?" she asked. "I don't know. I've been in here since you called. Has anyone else been in this bay in the last 20 minutes? Yolanda thought. The resident came in to check vitals, and there was a man. I assumed he was with the federal team that came in earlier. Dark jacket. He said he was doing a secondary sweep of the patient's contact points. What did he look like? 50s, maybe? Heavy set? He had a badge on a lanyard, but I didn't read it. Not Halki. Someone else. Which meant the network Pharaoh had been tracking had more than one local contact, which was a thing Lena had suspected but now knew for certain. She picked up the radio. "Pharaoh." Static for 2 seconds. Then, "Go ahead." The bag substitution wasn't Halki directly. There was a secondary contact in the facility within the last 20 minutes. Male, 50s, heavy set, unidentified badge. He accessed Bay 3. You need to flag the hospital's camera system. Understood. What's the patient's status? Stable for now. The substitution may not have been administered. Yolanda caught it before the line was reconnected. Lena looked at Kessler, at the slow, even movement of his chest. He's going to need the correct pralidoxime resumed. I'm going to pull a fresh bag from pharmacy and verify it myself. How long? She calculated the pharmacy run, verification, reconnection, monitoring time before she could responsibly leave. 30 minutes. A pause on Pharaoh's end that lasted long enough to carry weight. We're entering the station in 40. I need you there before we go in. I'll make 30, Lena said, and clicked off before Pharaoh could respond. She looked at Yolanda. Stay with him, she said. Don't let anyone touch him who you haven't personally verified. If someone comes in and you're not sure, you call security, and you keep them out until security arrives. You don't apologize for it. Yolanda met her eyes. What is happening tonight? Something that's almost over, Lena said, which wasn't fully true but was what Yolanda needed to function for the next 30 minutes. She pulled off her gloves, picked up the contaminated bag by its sealed port with 2 fingers, and moved. The hospital pharmacy at 2 a.m. ran on a skeleton staff. One pharmacist named Ortega, who'd been doing overnight shifts for 12 years, and who had the particular temperament of someone who'd made peace with the solitary nature of the work. He looked up when Lena came in and registered her expression with the readiness of someone who'd seen nurses come in at speed at all hours and had learned to distinguish the emergencies from the near emergencies. She set the substituted bag on the counter in front of him without touching the port. This came from Bay 3. I need you to look at this label. Ortega put on his glasses and leaned over it without picking it up. A full 5 seconds. That's not ours, he said. I know. I need a verified pralidoxime bag, 1 gram in 100, that you pull yourself from the secured stock, and I need to watch you pull it. She held his gaze. And I need this bag tagged as a potential contaminated substance and held in isolation until federal agents collect it. Ortega looked at her over his glasses. He was a methodical man who did not rattle easily, but something in what she'd said moved through his expression in a way that reorganized his understanding of the shift he was currently working. He pulled the verified bag. She watched every step, and by the time she was walking back toward the trauma floor, she was already working out the route to Vantage Station in her head. She reconnected Kessler's line herself, confirmed flow, watched his monitors for 5 minutes. His pressure ticked up fractionally, 89-91. The pralidoxime was real, and it was doing what it was supposed to do, which was reactivate the enzyme function that the compound had been systematically destroying for however many days he'd been held. "He's going to make it," she told Yolanda. It was a probability statement, not a guarantee, but probability was what they had. She left the hospital at 1:47 a.m. Vantage Station's main entrance was cordoned. Not obviously, no police tape, no visible personnel at street level, but the transit authority vehicles parked at the service entrances were wrong for 2 a.m., and the man in a reflective vest standing at the northeast corner wasn't moving the way a transit worker moved. Lena clocked all of it on the approach and found the staging point Farrow had established in a maintenance yard adjacent to the north face of the building. 8 people. Farrow, Soto, 5 tactical agents in gear she recognized as Level C chemical protective equipment, not the full encapsulated suit, but respiratory protection and resistant coveralls, and a woman she didn't know who was standing in front of a monitoring station laid out on a folding table. The monitoring station had atmospheric sensors connected to a laptop showing real-time air quality readings from inside the facility. "The maintenance crews?" Lena asked as she reached the group. "Evacuated. Facility manager is cooperating. He thinks it's a gas leak." Farrow handed her a vest, not tactical but chemical resistant, and a respiratory mask. "We have 1 confirmed device location, lower level 3, ventilation corridor B. 2 probable locations based on architectural mapping, and your suggested placement at the confluence junction. 4 locations total." 4. Lena pulled the vest on. "Simultaneous approach or sequential?" "Sequential is safer for the team. Simultaneous is faster." Farrow looked at her. "We have 1 team, 8 people including you. Split 4 and 4, 2 locations each. You need to clear all 4 within the same time window, because if whoever planted these has a remote trigger and they see you moving on one location, they'll activate before you reach the others." "That's the plan," Soto said. He'd been listening from the side with his arms crossed, and the expression of someone who was reserving judgment on a new variable. "The question is which locations require the most technical knowledge to disarm." Lena had read enough of the procurement file in the van to have a working understanding of the delivery system design. Not complete, not an engineer's understanding, but enough to form an opinion. "The confluence junction," she said. "That one is positioned to interact with the ventilation dynamics in a way that the others aren't. If the device there is activated, the other 3 become secondary in terms of priority. The dispersal from that location will reach areas the others won't get to on their own. That's your primary target." "Then you're on that team," Farrow said. It was not framed as a question. Lena finished sealing the mask and looked at the monitoring station's atmospheric display. The readings were clean. Whatever was in the facility hadn't been activated yet. That was the one piece of good news, and she didn't let herself put too much weight on it. "One thing," she said, "Halke is still unaccounted for. His secondary contact was in the hospital less than an hour ago. If Halke knows we've moved from the hospital to here, there's a possibility that information has been passed forward." Farrow nodded. "We have people watching the facility perimeter. Anyone approaches will know." "Not just the perimeter. The maintenance access network runs under the building and connects to 2 adjacent structures, the parking garage on the west side and the utility corridor on the east. There are entry points from both that aren't visible from street level." Soto was already pulling up a schematic on a tablet. Farrow spoke into her radio, repositioning 2 agents to cover the access points Lena had named. It wasn't a perfect fix. It was the available fix. "Move in 5, Farrow said to the group. Yeah. The inside of Vantage Station at 2 a.m. was a specific quality of emptiness that large public spaces had when the people who normally populated them were gone. The infrastructure running on its ordinary cycle, lights at reduced level, ventilation moving, the electronic displays still cycling through route information for trains that were running on skeleton service. The main concourse was maybe 200 meters from end to end, ceiling high enough to feel like an indoor public space rather than a building, the kind of architecture that was designed to make thousands of people feel accommodated simultaneously. Empty, it felt like a stage set. Lena moved with Pharaoh and two agents, a woman named Bryce and a man named Kowalski, who said nothing but moved with the precision of someone who'd done urban operations before. The other four, with Soto leading, had split off at the main concourse and descended to the lower platform levels via a service stairwell on the east side. The confluence junction was on the sub-basement level, one floor below the lowest platform, accessible through a maintenance corridor that ran behind the ventilation equipment housings. It was not a space that passengers ever saw. A low-ceilinged concrete corridor, about 4 feet wide, with industrial ducting running along both walls, metal access panels, the ambient noise of airflow that was constant enough to feel like silence after a few minutes. Lena had the schematic in her head, and she moved through the facility ahead of Pharaoh and the agents, not recklessly, but with the confidence of someone operating from a mental map rather than a paper one, which was faster when the corridor split and the signage was either absent or meaningless without context. Bryce stayed on her left. Kowalski watched behind. At the junction, they stopped. The ventilation confluence was exactly what the schematic had shown. Two major duct systems meeting at a Y-shaped mechanical housing roughly the size of a small vehicle, with access panels on both sides and the constant directional pressure of moving air pulling toward the central distribution point. The junction fed directly into 4 of the station's main ventilation loops. Lena had been right about the placement logic. If you understood the airflow dynamics, this was where you put a device if you wanted maximum dispersal from a single deployment. She found it because she knew where to look, not in the obvious locations, on top of the housing or mounted to the duct faces, but behind the secondary access panel on the left side, where the panel had been refastened with misaligned screws. 2 of the 4 screws weren't fully seated. Someone had opened this panel recently and put it back in a hurry. "Here," she said. Pharaoh was beside her immediately. Kowalski trained his light on the panel while Bryce took a perimeter position facing back the way they'd come. Lena removed the panel herself because Pharaoh's gloves were bulkier and the screws were small. Her hands were steady in the specific way they'd been trained to be steady, which wasn't the absence of an adrenaline response but the management of it. She could feel her pulse in her fingertips, and she worked around it. The 4th screw gave, and she lifted the panel away. The device was seated against the inner duct wall on a magnetic mount. Compact, smaller than she'd expected given the delivery specification in the procurement file, which meant either she'd misread the documentation or the engineering was more sophisticated than the materials suggested. A cylindrical housing about the size of a large thermos, with 2 independent trigger mechanisms, a timer unit visible through a small clear window on the end cap, and a wireless receiver module mounted to the side. The timer was running. She had not expected the timer to be running. She had not expected a countdown already in progress, and the number visible through the window, which required her to lean close enough to read in the maintenance corridor's inadequate lighting, made her understand immediately why the people who'd planted this had chosen tonight. 2 hours and 11 minutes, which meant the timer had been started earlier tonight, independently of the team's arrival, which meant it was not a response-triggered activation. It had been set to go off at 4:58 a.m., the beginning of the first morning maintenance shift handover, when the facility transitioned from overnight skeleton crew to the first wave of operations staff, when the platforms would begin filling with the earliest commuters and the transit workers who'd been there overnight would be moving through the concourse toward the exits. "Timer is active," she said. "Set for 4:58, 2 hours and 10 minutes from now." Pharaoh was on the radio immediately, relaying to Soto's team. The response came back in fragments. Confirmation that Device 2 had been located on Level 3 and had the same timer configuration. Same target window. "Wireless receiver," she said to Pharaoh, pointing at the module on the side of the housing. "That's the remote override. If someone has the transmitter, they can trigger this early, regardless of the timer. Can you disable the receiver without disturbing the timer mechanism? She looked at the configuration for 4 seconds. If the receiver is separated from the primary circuit before I touch the timer, yes. If I do it wrong, I don't know what the fail-safe response is. She looked at Pharaoh. That's an honest answer. Give me your best assessment. The receiver module is seated on the housing with 2 external leads. If I cut the leads in the right sequence, the timer mechanism stays isolated. The risk is that the housing has an internal connection between the 2 systems that isn't visible from the outside, and if that's the case, disturbing either one could complete a trigger circuit. A beat. I've seen this configuration before in a different form, different compound, different context. The design principle is the same. How did you handle it then? I wasn't the person handling it then. She looked at the device. But I watched someone who was. Pharaoh was quiet for exactly the length of time it took her to assess the options. Do it, Pharaoh said. Lena pulled off her outer gloves, worked in the thinner nitrile pair underneath, and positioned herself in front of the device with her knees on the concrete floor of the maintenance corridor, her light angled over her left shoulder. She located the first lead, a thin coaxial connector running from the receiver module to the housing. She traced it to its origin point, found the second lead, thinner, running in a parallel path that diverged before the housing connection point. Cut the second one first. That was what she'd watched. The second lead was the circuit isolation. Her hand was not shaking. Her hand was not shaking because she had decided it wasn't going to, which was not the same as not being afraid. She cut the second lead. Nothing. No response. The timer continued its count. She cut the first lead and lifted the receiver module away from the housing in one deliberate motion. The device sat in its mounting with the timer still running, and the wireless trigger now physically separated from it. She held the receiver module in her left hand and breathed once. Receiver is isolated, she said. She heard Pharaoh exhale. Then Soto's voice came through the radio with a different quality. Not the operational calm he'd been maintaining, but something compressed and urgent underneath the words. Pharaoh, we have a problem on level 3. Pharaoh took the radio. Report. Device 2 is located and the receiver is isolated, but there's a third device down here that wasn't on the map. It's not in the ventilation system. It's mounted to the structural support column adjacent to the platform. The configuration is different. It's not using a timer. It's got a single trigger mechanism, and it's pressure sensitive. Pressure sensitive. Lena was on her feet before Soto finished the sentence. Pressure sensitive meant it was designed to activate on physical contact, not a timer, not a wireless trigger, but a response to someone attempting to move or disarm it without the correct disengagement sequence. Does your team have a disengagement protocol for pressure trigger devices? She said, loud enough for Pharaoh to relay. Soto answered directly. He'd heard her. Negative. That configuration requires a manual specialist. Pharaoh looked at Lena. Lena looked at the receiver module still in her left hand, and then at the schematic in her memory, and then at the corridor behind them leading back toward the platform levels. How far is level 3 from here? She asked. 7 minutes through the service route, Kowalski said from behind them. She handed Pharaoh the isolated receiver module and the panel she'd removed. Don't let that reconnect to anything. She picked up her light. Tell Soto's team not to touch it. Don't let anyone within 4 meters of it until I get there. Pharaoh reached out and caught her arm for the second time tonight. You told me you weren't a specialist, Pharaoh said. I'm not. Lena met her eyes. But I know the engineering principle, and your team doesn't, and 4 meters is not a safe distance if someone bumps that column. Pharaoh released her arm. Lena moved. Dead. The service route between the sub-basement junction and the third platform level was 7 minutes at a normal pace. She made it in 5.5, moving through maintenance corridors and a utility stairwell that smelled of concrete dust and machine oil, with Kowalski behind her and her light bouncing off the low ceilings. She was breathing hard by the time she reached the platform level entry point, not from the pace, but from the particular physical response of controlled adrenaline working through a body that had been sedentary for 7 years and was now being asked to perform as if it hadn't been. Level 3 was the deepest platform, the one that served the 2 freight-adjacent lines that ran at reduced frequency. The platform itself was maybe 80 meters long, bare concrete, the overhead lights at overnight minimum. The structural columns ran at intervals down the center line of the space, thick, reinforced concrete supporting the weight of two platform levels and the concourse above. She found Soto and his team in a loose perimeter around the third column from the south end. The device was mounted at the base of the column, approximately 30 centimeters above the platform floor, on a bracket that had been bolted directly into the concrete. It was larger than the units she'd disarmed in the sub-basement, a flat disc housing about the size of a dinner plate, matte gray, with a single pressure activation plate visible on the upper face. No timer display, no external leads. A pressure mechanism meant it was armed and would remain armed until the sequence that disarmed it was completed, and if anything contacted the activation plate incorrectly, it would fire. The 4 meters of clearance Soto had established was not enough. She could calculate the dispersal radius in her head with enough accuracy to know that Level 3's ventilation would carry aerosolized compound through the entire third platform and partway up the access stairs before it hit a containment boundary. Maybe 60, 70 people in that zone during the morning rush. More if the stairwell timing aligned with peak flow. She crouched in front of it. "Don't get closer than that," Soto said from behind her. "I'm already closer than that." She studied the housing. The pressure plate was a passive mechanism. No battery, no electronic component visible, which meant it was purely mechanical. A spring-loaded striker held in compression by the plate, triggered by removal of the plate or by sufficient perpendicular pressure on its surface. The disengagement would be a secondary pin. Every pressure mechanism of this type that she'd encountered in documentation had a secondary pin. A small locking element that, when engaged, blocked the striker travel. The pin would be on the side of the housing, small, probably requiring a tool. She looked at the side of the housing. Left side, nothing visible. Right side, a small recessed point, maybe 3 millimeters in diameter, flush with the housing surface. The pin. "I need a metal rod or probe, 3 millimeters or smaller in diameter." She said it without turning around. She heard movement behind her. 30 seconds of searching through equipment, the sound of a case being opened. "Antenna segment," someone said, and a thin metal rod about 15 centimeters long appeared at the edge of her peripheral vision. She took it. She looked at the pinpoint, looked at the pressure plate. The sequence was pin first, then plate. Engage the pin to block the striker before the plate was disturbed. If the pin engaged correctly, removing the plate would be safe. If the pin didn't engage, but bumped, if the geometry was wrong, or if there was a secondary mechanism she hadn't seen in the documentation, or if her memory of the engineering principle was imprecise in a way that the engineering reality punished, then the plate removal would trigger the striker regardless. She positioned the rod. Her hands were steady. Her hands had been steady through all of it, and she was going to think about that later, about what it meant that this was the part of herself she could never fully leave behind. Not the skill, not even the knowledge, but the specific quality of stillness under pressure that training had built into her body so thoroughly that 7 years of civilian life hadn't touched it. She pressed the rod into the pinpoint. She felt resistance and then a small definite click. She pulled her hands back 1 inch and waited 3 seconds. Nothing. She said, "Pin is engaged? I'm removing the plate." Lena, Soto, behind her, with something in his voice that was not quite protest. "If the pin held, this is safe." She positioned both hands on the edges of the pressure plate, fingers clear of the center surface. "If it didn't, there's nothing any of us can do about it from 4 meters. She lifted the plate. The striker was frozen in its compressed position. The pin had engaged. The mechanism was inert. She set the plate on the platform floor beside her knees and sat back on her heels and looked at the striker assembly for a moment, at the small mechanical components that had contained something capable of killing dozens of people, now frozen and harmless because a pin the size of a toothpick was blocking a spring. "Clear," she said. The sound that went through Soto's team was not celebration. It was the specific quality of people who'd been holding a breath for several minutes and released it simultaneously. Not relief, so much as the physical correction of something held too long. Soto's radio cracked. Pharaoh's voice. "Soto, fourth device confirmed at the Confluence Junction secondary access. Kowalski is with the team there. Timer shows same window as devices 1 and 2. They need a disengagement sequence for a wireless receiver identical to what Marsh handled in the sub-basement. Lena got to her feet. Her knees hurt. She noted it and moved past it. Talk them through it, she told Soto. Kowalski saw me do the first one. He can do it. Soto was already on the radio, relaying. She walked to the edge of the platform and stood there for a moment, looking at the empty track in the dark below the platform edge, and tried to organize what she knew. 4 devices, 3 disarmed, 1 in progress. Kessler was stable at the hospital. Hulk was missing. His secondary contact, the heavy-set man with the unverified badge, was also unaccounted for. The operation had a physical component, which they were managing, but the people behind it were still free, and free people with the resources to build and plant 4 modified chemical devices in a major transit hub were not people who ran when their primary operation was disrupted. They adapted. Her radio cracked. Pharaoh. 4th device clear. All units secured. Lena breathed. Then Soto's radio, the one he was using for perimeter communications, cracked with a different voice. One of the external agents monitoring the facility approaches. Pharaoh. East Utility Corridor. We have movement. 2 individuals on foot, moving fast toward the sub-basement access point. Lena turned. Description? Pharaoh's voice, sharp. Male, 50s, heavy set, and a pause, the kind that happened when what you were seeing didn't match what you were expecting. And a second male in a medical facility ID badge. Hold on, he's carrying something. It looks like a case. The heavy-set man from the hospital. And someone with a medical badge. Not Halke. But if not Halke, then who? And then the answer arrived in Lena's mind with the particular clarity of something that had been present for a while without being looked at directly. The procurement network. The physician's credentials used to move acquisition paperwork. Pharaoh had said they'd identified one name, one physician. But procurement networks didn't have single points of failure. They were designed with redundancy. There wasn't one physician. There were 2. And the second one was walking into the sub-basement of Vantage Station, carrying a case she hadn't seen the contents of, toward a ventilation junction where her team had just removed 4 devices and left the access panels open. She was moving before she finished the thought, pushing past Soto toward the service stairwell, calculating the fastest route from level 3 to the sub-basement utility corridor. And the radio in her pocket was live with Pharaoh trying to reach her, and she heard her own name 3 times before she answered. Pharaoh. The case? She said, breathing with the effort of the stairwell. The case he's carrying, it's a backup device. Silence on the line for a beat that felt much longer. Say again. They built redundancy into the operation. The 4 devices we found were the primary system. He's carrying a backup that was never in the facility until now, which means it was never on our radar, which means we have no intelligence on its configuration. She reached the sub-basement landing and pushed through the door. Where are they? The perimeter agent's voice. They've entered the east utility access, moving toward your position. How far behind us? Soto, who had apparently followed her down, said into his own radio. 90 seconds, maybe less. 90 seconds from the east utility access to the confluence junction in the sub-basement was exactly 90 seconds more than they had, because the sub-basement corridor was 40 meters long and offered 2 options, a junction that split toward the ventilation housing and a dead end. She understood what she needed to do before she finished forming the thought. She turned off her light. Marsh, Pharaoh said through the radio, what are you doing? Containing the approach, she said quietly, and clipped the radio to her pocket and stood in the dark of the sub-basement corridor and waited for the sound of footsteps coming from the east. She heard them in under a minute, 2 sets, moving with purpose, one heavier than the other, the sound bouncing off the concrete in a way that told her distance and direction more accurately than she'd expected. The ventilation noise was a constant background, which would cover her own sounds as long as she didn't move. The light from their torch appeared at the far end of the corridor, 40 meters. 35. She was standing off the central axis back against the duct housing in the angle of shadow where the junction split. If they were moving toward the ventilation housing, they'd pass within 2 meters of her, 30 meters, 25. She could hear them now, breathing, The sound of the case being carried, a low exchange of words she couldn't make out fully but could parse partially, something about the timer, something about the team already inside, and then a single phrase that arrived with perfect clarity in the corridor's acoustics. The backup goes in the primary housing. It doesn't matter what they found. The housing feeds the whole system. 20 meters. Her radio cracked once. Pharaoh trying to reach her. Both lights stopped moving. Silence. Then the heavier footsteps accelerated toward her position. She moved first, not toward them, sideways, pressing into the angle of the junction where the corridor split, letting the shadow from the duct housing cover her completely. The tactical choice wasn't confrontation. It was positioning. Two men, one carrying a case, moving fast in a narrow corridor with one torch between them. The light was the problem. As long as she was outside its arc, she had options they didn't know about. The heavier footsteps slowed. She heard him stop, heard the case set down on concrete. A careful sound, not a drop, someone who respected what was inside it. And then the torch swept the corridor ahead in a slow arc, looking for what had made the radio noise. She was 4 feet from where the torch stopped. The beam held for 3 seconds and then moved on. She breathed through her nose. Behind her, she could feel the corridor's geometry. The junction branching left toward the ventilation housing, right toward the dead-end utility access. She needed them to go left. The ventilation housing was the destination they'd named, which meant left was already their intention, but she needed them committed to it before Pharaoh's team came through the east entrance. Because if they heard the entry team, they might trigger the backup device at distance. She didn't know its trigger configuration, didn't know if it had a remote option, and didn't know was the operative phrase she kept returning to, the gap in her intelligence that changed everything about how she managed the next 90 seconds. She let them walk past her. 3 meters. 2. The heavy-set man was first. She could see him as a silhouette against the reflected light from the torch the second man was carrying, and she took in what she could. Large, moving with the deliberate energy of someone in reasonable physical condition who was also scared, carrying nothing in his hands now because the case had been, she tracked, passed to the second man. The second man was behind him, slightly shorter, the case in both hands, and she saw the badge on the lanyard swing as he moved. She looked at the badge. Even in the poor light, at the angle she had, she caught enough. Not a name. A hospital logo she recognized, not Harlow City General, a different facility. Meridian Health, the large private hospital complex on the east side of the city, affiliated with Harlow City General through a shared administrative network that meant their procurement systems talked to each other. Not a second physician from her hospital. A connected system, a wider reach. She filed it and moved. She stepped out of the shadow behind the second man and covered the distance between them in 4 steps. Not running, because running made noise. And hit him with a controlled takedown, left arm across his chest, right hand guiding the case as he went down so it didn't impact the floor with his weight. She felt him react, felt the surprise and the instinct to fight it, and she controlled his arms against his body as they went to the ground and kept her weight on him just long enough for him to understand that it wasn't going to work. "Don't move," she said, very close to his ear. He didn't. The heavy-set man had spun at the sound. His hand went to his jacket. "Federal agents entering from the east," she said, loud enough for him to hear clearly. "You are currently between me and them, and there is one exit from this corridor. Think carefully about what you reach for." 4 seconds of dark corridor. Then the east entry lights came on. Pharaoh's team, 2 agents moving fast, torches and weapons up. The heavy-set man looked at them and looked back at Lena and made the calculation visible on his face, the way people did when the math resolved against them completely. He took his hand away from his jacket. "Down," Pharaoh said from the far end of the corridor. "On your knees." He went down. Lena kept the second man pinned until Kowalski reached her and took over, at which point she stood, looked at the case on the floor beside her, the backup device, still closed, still intact, and picked it up by the handle with both hands and did not let herself feel the particular quality of holding something in her hands that could have killed 100 people in a transit hub by morning. She carried it to the ventilation housing and set it on the floor 3 meters from the nearest duct access and stepped back. "I need a containment bag," she said. Bryce had one. They sealed the case without opening it. Lena stood in the sub-basement corridor and looked at the two men on the ground. The heavy-set contact with his hands behind his back, and the Meridian health physician who was breathing fast and staring at the floor with the expression of someone experiencing the specific terror of a plan that had worked for months suddenly, completely, and irrevocably failing. And she felt something that was not satisfaction exactly, because satisfaction implied it was over, and it wasn't over, but was the functional equivalent of a weight redistributing. Pharaoh came to stand beside her. "You went dark," Pharaoh said. It wasn't an accusation, but it wasn't nothing either. The radio cracked when they stopped moving. They'd heard it. If I'd answered, they'd have triggered the backup. She looked at Pharaoh. "The device is sealed. Your team can assess the configuration." That was a significant risk. The alternative had worse odds. She paused. "I made a call." Pharaoh looked at her for a moment with an expression that was harder to read than most of her expressions. Something between acknowledgement and the professional reluctance to say the thing that acknowledgement would require. Then she turned to the agents managing the two men on the ground. "Get them up. Transport to the federal staging vehicle. Nobody talks to them until counsel is present and I'm in the room." The sub-basement cleared in the way that spaces cleared when operational pressure lifted. Gradually, with the particular deflation of people who'd been running on adrenaline returning to their baseline one system at a time. The monitoring team outside confirmed atmospheric readings still clean. All 4 primary devices secured. The backup secured. The station's ventilation system had never been reached. Lena walked out through the main concourse because it was the fastest route to the staging area, and the main concourse at 3:15 a.m. was exactly as empty as it had been on the way in. The overhead displays still cycling, the lights still at overnight minimum. The whole architecture of the place engineered for thousands of people and containing none. She sat down on a bench in the center of the concourse. She hadn't planned to. Her body made the decision autonomously, which was its way of telling her something she already knew intellectually. She sat and put her forearms on her knees and looked at the floor for a minute and let the particular crash of the last several hours move through her without trying to manage it. Her phone rang. "Yolanda." "Kessler's pressure is up to 98/64, Yolanda said without preamble. "He's been more alert in the last 30 minutes. He's not talking, but he's tracking. Pupils are responding better." Lena closed her eyes. "That's good. He keeps looking at the door like he's waiting for someone." She thought about that. "Tell him it's handled. Use those words. It's handled. He'll understand." A pause on the line. "Should I ask you what any of this means?" "Probably not tonight. Are you okay?" It was a question with more layers than the 4 words suggested, and Yolanda had the intelligence to know that and ask it anyway. Lena sat with it for a second longer than necessary. "Working on it," she said. She hung up. She sat on the bench for 2 more minutes, then she stood and walked to the staging area. The next 3 hours had a different texture from the hours that had preceded them. Less compressed, more procedural, the operational machinery of consequence beginning to engage. Pharaoh's team processed the site. Federal forensic units arrived around 4 a.m. and began the detailed assessment of all 5 devices. 4 primary, 1 backup. The 2 men from the sub-basement were in separate federal vehicles on the north side of the facility, awaiting transport. The facility manager, who had spent the night believing he was managing a gas leak, was given a modified briefing that told him enough to understand the gravity without telling him anything classified. Lena gave her statement in the staging vehicle to a federal documentation agent who typed everything she said without reacting to it, which was either professional discipline or the specific numbness of someone who processed events like this regularly. She told it in sequence and didn't editorialize because editorializing required energy she was currently conserving. The documentation agent asked 3 follow-up questions. She answered them. Halki was still unaccounted for. It was Pharaoh who told her, coming into the staging vehicle at 4:20 a.m., with coffee she hadn't asked for and setting it on the table in front of her without comment. The kind of gesture that was either habit or consideration, and Lena was too tired to determine which. "We have a location on Halki," Pharaoh said. Lena looked up. He attempted to board a private charter flight at Harlow Regional Airport at 3:45 a.m. Airport security flagged his name. He was on the federal watch list as of 2 a.m. He's in custody. Airport. Something in Lena's chest that had been tight since she'd heard Yolanda's voice on the phone telling her the IV bag had been replaced. Something that had been tight since she'd looked at Kessler in Bay 3 and known that the man nominally in charge of his care had been part of the architecture of his poisoning. Released enough that she felt the absence of it. Did he have anything on him? A personal drive, encrypted. Our technical team is working it. Farrow sat across from her with her own coffee. The Meridian Health physician is Dr. Aaron Whitfield. He's been on the medical staff there for 8 years. His procurement access gave the network reach into the shared administrative system. Materials routed through Meridian's accounts and partially flagged as medical supply orders. Kessler's embedded role was to document exactly this kind of routing. Hulk and Whitfield coordinated. Hulky provided the Harlow City general access and the local knowledge. Whitfield provided the Meridian side, and we believe the technical expertise. His specialty is respiratory medicine, which maps to the delivery system design. She thought about Hulk standing in the trauma bay looking at the patient he'd claimed was a polysubstance overdose, looked at the monitors, gave competent-sounding orders, managed his team's response with the authority of 11 years in the role. She thought about the precision of that performance. Not a man trying to actively derail the treatment, but a man trying to ensure the situation resolved in a specific direction without his fingerprints on the outcome. The lorazepam order hadn't been malicious in isolation. It was a choice that looked clinically reasonable and would, in the absence of someone who recognized what they were actually treating, have been sufficient to allow Kessler to deteriorate past the point of communication. That was the part that was hard to sit with, not the criminal network, not the devices in the transit station. Those were the kind of things you could categorize as threats and respond to tactically. What was harder was the image of a physician who had taken an oath and spent 11 years inside it, using the structure of that oath as cover for something that required him to watch a man die on his table and let it happen. "What are the charges?" she asked. "Conspiracy to deploy a chemical weapon, terrorism facilitation, attempted murder, for the bag substitution, which we believe was Halke's instruction to Whitfield's contact." Farrow paused. "Federal charges. Neither of them is going to see a courtroom for anything less than a federal prosecutor." Lena drank the coffee. It was bad, the kind made from a machine that had been running all night, and she drank it anyway. "The personal drive," she said. If Kessler was documenting the procurement routing, his own records might be on a secured channel somewhere. He was embedded for 9 months. That's a significant evidence file if it survived whatever happened to him in those 4 days. Farrow nodded slowly. "We're exploring that. His handler has been notified. There's a recovery protocol for embedded operatives in his situation. He'll want to know the station is clear. We'll brief him when he's stable enough." Outside the staging vehicle, Lena could hear the first sounds of the city beginning its morning cycle. A truck somewhere, a distant train, the ambient frequency shift that happened when a city transitioned from night to early morning, the quality of sound changing as the infrastructure that served daytime life began to warm up. In 2 hours, the first commuters would be arriving at Vantage Station's surface entrances. The Transit Authority would need to make decisions about reopening. The federal team would need to make decisions about how much to say publicly and in what form. These were not her decisions. She was aware of that with something that was partly relief and partly a thing she didn't want to examine too carefully. The way that stepping back from a decision space felt different when you'd been inside it than it did in the abstract. Her radio cracked. One of the external agents, "Farrow, vehicle approaching the north staging perimeter. Federal Registry. It's the transport from Harlow City General. They're bringing the patient." Farrow looked at Lena. "His condition was improving," Farrow said. "The team at the hospital coordinated with his handler. Given the situation, it was determined that a controlled federal medical environment was safer for him than a civilian facility." "Who made that call?" "His handler and our medical liaison." A pause. "It was the right call?" It probably was. Lena knew that. The logic was sound. Kessler in a civilian hospital with a staff that had just been involved in a federal operation, with an attempted IV substitution still fresh, with Halke's network not yet fully mapped, was a less controlled situation than Kessler in federal custody with dedicated medical oversight. The right call was sometimes a thing you understood and still felt complicated about. She got up. Bochum. The transport vehicle was a modified medical van, not an ambulance, something more low profile, with federal medical staff and equipment. They brought Kessler in on a stretcher at 4:38 a.m., and the federal medical team took primary responsibility the moment he was inside the staging perimeter, which was appropriate and which Lena stood back to allow. But Kessler's eyes found her anyway. He was more alert than he'd been in the hospital. Not functional, not well, but present in a way that the organophosphate exposure and the days of whatever had been done to him had been suppressing. His eyes tracked. They found her at the edge of the perimeter and stayed. She walked over. She crouched beside the stretcher at the level of his face. "Vantage station is clear," she said quietly. "All devices secured. The people you were tracking are in federal custody." She paused. "You got the information out. It worked." His lips moved. She leaned closer. "How?" he said. Not a complete sentence, just the word. "You told me the name," she said. "That was enough." His eyes stayed on her for a few more seconds with an expression that was too exhausted to be called anything in particular, but that contained something, acknowledgement maybe, or the specific recognition one person had for another who'd done a thing that needed doing. Then his eyes closed, and the federal medical team continued their assessment, and Lena stood up. Farrow was waiting behind her. "We need your formal debrief on record before 6 a.m., Farrow said. "Full account, documented, for the federal file." "I know. After that, you're free to whatever your normal looks like." Lena looked at her. "We're also going to need you available for the prosecution process," Farrow added. "Testimony, potentially. Your identification of the compound, your treatment of the patient, the evidence of the IV substitution, that's material to the criminal case." "I understand." "It will involve being identified publicly, as someone with a specific background." The thing Farrow was saying in careful formal language was, your cover identity is over. Not by choice, not by design, but as a consequence of the night's events. The phone call made from memory, the identification of a classified compound, the sub-basement takedown, all of it documented now in a federal record that existed whether she wanted it to or not. The 7 years of quiet and invisible and ordinary were not going to survive the paperwork. She'd known this since the moment she dialed that 11-digit number from the nursing station. She'd known it before that, if she was being precise. She'd known it when she leaned over Kessler's gurney and smelled the compound and felt her nervous system respond to it with recognition instead of alarm. Some part of her had already understood what the night was going to require. "I know," she said for the third time, and meant it. The formal debrief was in the staging vehicle with Farrow and a second federal officer who said little and wrote everything. Lena walked through it sequentially: the patient's presentation, the compound identification, the atropine protocol, the phone call, the transit to the station, the sub-basement, the backup device, the takedown. She said it plainly, without qualification or self-commentary, because that was how debriefs worked, and because she had given enough of them in enough context to know that the most useful account was the one that stayed close to event. It took 45 minutes. When it was done, the documentation officer left, and Farrow poured herself another bad coffee and offered one to Lena, who declined this time. "The network," Lena said. "Hulk and Whitfield are the Harlow City contacts, but procurement networks have supply chains. Whoever manufactured the compound, whoever assembled the devices, whoever planned the Vantage Station deployment, those people are not in your 2 vehicles outside." "No," Farrow agreed. "Kessler's 9 months of embedded documentation is going to be the thread you pull to get there." "That's our assessment as well." "Then you need him functional, which means the federal medical team needs to understand the specific compound's long-term neurological effects and not assume that stabilization equals recovery." She said it without apology. "The modified organophosphate he was exposed to has a potential for delayed onset peripheral neuropathy and cognitive disruption that can emerge days after the acute phase resolves. Someone needs to be monitoring for that specifically." Farrow made a note, actually wrote it down, which Lena respected. "I'll make sure the medical team is briefed," Farrow said. "Can you write up the clinical specifics?" "I can write up what I know. For the rest, you'll want a CBRN specialist with access to the specific compound's documentation, which we'll have once our lab finishes analyzing the devices. Then I'll give you what I know and flag the gaps. She picked up the pad on the table and wrote for 8 minutes. Compound presentation, treatment protocol rationale, the specific monitoring parameters that mattered in the recovery window, the gaps in her knowledge and where to find what would fill them. She wrote it like a clinical note because that was the format she knew and because the format carried its own kind of authority. She handed it across. Farrow read it without hurrying, set it down. When Halki is formally charged, Farrow said, there will be a press process. The federal agency doesn't typically comment in detail, but the hospital will have to respond. The medical board will be notified. His license suspension will be immediate pending the investigation. I know. The staff at Harlow City General are going to have a complicated few weeks. Lena thought about the trauma floor, about Yolanda, about the resident who'd stopped typing when Lena raised her voice, about the nurses who'd watched the interaction with Halki with the careful neutrality of people who knew better than to take sides out loud, about 3 years of showing up for shifts and doing her work, and being known as the nurse nobody particularly remembered. They'll manage, she said. Will you go back? The question surprised her, which was information. She hadn't thought as far as what happened to the version of her life she'd been living, which meant some part of her had already accepted that it was a question requiring an answer rather than an assumption she was returning to. I don't know, she said honestly. Farrow nodded, which was neither encouragement nor discouragement. The federal system has positions for people with your combination of skills. It's not something you have to decide tonight. No, Lena agreed. It's not. She left the staging vehicle at 5:50 a.m. The city had fully committed to mourning by then, the light still low and gray-blue in the east, but definitively there, the kind of early light that made everything look provisional and temporary. The Vantage Station main entrance was still cordoned, but the transit authority vehicles had been joined by 2 federal evidence vans and a public affairs liaison who was talking to the facility manager with the careful pacing of someone managing a narrative in real time. By 7 a.m., there would be questions. By 8 a.m., there would be media. By noon, depending on what the federal agency decided to release, there would be a public account of some version of the night's events. What that account would contain about her, she didn't yet know. She stood on the sidewalk outside the staging perimeter and breathed the early morning air, which was cold enough to register and clean enough to notice. And she let herself be tired in the way she hadn't been able to be all night. Not the productive tiredness of someone still in motion, but the real kind, that sat behind her eyes and made the ordinary world look slightly more fragile than usual. Her phone buzzed, a text from a number she didn't have saved. Good work tonight. DK. She didn't know who DK was. Probably she should. The message told her the information was already moving through channels she wasn't tracking, which was either reassuring or the opposite depending on how you thought about it. She put the phone away. She started walking, not toward the hospital, not toward home, just walking in the early morning light of a city that had no idea how close the night had come to ending differently. People were starting to appear. A runner on the opposite sidewalk, a delivery truck double parked ahead, a woman walking a dog with the focused disinterest of someone who'd been up since before the city. All of them moving through a Tuesday morning in Harlow City that was going to feel like a Tuesday morning in Harlow City. She'd walked 3 blocks when Farrow called. Halki's drive, Farrow said. Our technical team cracked the first layer of encryption. There's a significant amount of internal hospital communication on it. Emails, procurement authorizations, scheduling records. A pause. There's also a personnel file. Yours. Lena stopped walking. He'd been running a background inquiry on you, Farrow continued, her voice careful. Initiated 18 months ago. He used the hospital's HR access and paid for a private research service to go deeper. The file has your service record summary, not the classified portions, but enough. Your deployment history, your separation date, your current employment. 18 months ago. Which meant that whatever had triggered his suspicion predated everything she knew about the network's Harlow City operation. He'd been watching her for a year and a half. Why? She said. Not to Farrow specifically, just the word released into the cold morning air. That's what we're working to establish. The most likely read is that someone in the network flagged the hospital as a potential exposure point. They were using its procurement system. They needed to know if anyone on staff was a risk. Farrow paused. You fit a profile they'd be cautious about. 18 months and he never said anything. Never changed how he treated me. No. He just kept watching. She thought about that, about Halki at the nursing station with his professional ease, calling her Emily, calling her Lena, with the dismissive familiarity of someone who'd categorized her and filed her. She thought about whether the contempt had been real or performed, and then decided it didn't matter because the outcome was the same either way. There's one more thing, Farrow said. The file he kept on you. The last entry is dated 4 days ago. The same 4 days Kessler had been missing. He updated it 4 days ago? She said. Added a notation. 1 line. Farrow read it. Asset remains unactivated. No action required at this time. Unactivated. As if she were an element of the problem to be managed rather than a person. As if her 7 years of civilian life were a dormant condition that he was monitoring for signs of re-emergence. As if he'd known, in some calculus she didn't have access to, that she was going to be the problem he'd been waiting for. She started walking again. I'll be at the hospital by 7, she said. The debrief is complete. You don't have to... Kessler's monitoring parameters need to be communicated directly to whoever is managing his care. The written note is sufficient for the broad strokes, but not for the clinical judgment calls. She paused. And there are people at the hospital who are going to find out about Halki in the next few hours. And they're going to need someone to answer questions. That's not your responsibility. Maybe not. She crossed an intersection, the pedestrian light green. But I've worked that floor for 3 years. They deserve a conversation with someone who was there. Farrow was quiet for a moment. The Meridian Health Board was notified about Whitfield at 5 a.m., she said. His privileges have been suspended pending the federal investigation. The medical board notification goes out at 8. And Harlow City General? Hospital administration is being contacted now. The board chair is being briefed. Halki's suspension will be effective immediately upon notification, which happens in, a sound of checking, approximately 40 minutes. 40 minutes. Which meant the trauma floor would learn about its chief of division in the middle of the morning shift handover, which was the worst possible time. Everyone present, no one with the capacity to process it before they had to keep working. She increased her pace. The hospital was 9 blocks from where she was. She covered them in 11 minutes. The ER at 6:45 a.m. had the specific energy of a shift change in progress. The night staff finishing their notes and the morning staff arriving, the handover of cases and the comparison of events, the ordinary institutional continuity of a place that ran around the clock and absorbed disruption by dividing it across enough people that no single person had to carry too much of it. Yolanda was still there. She'd been there for 11 hours and it showed in her face, but she was upright and functional, which Lena recognized as the particular stubbornness of someone who'd decided she wasn't leaving until she knew how things resolved. She looked at Lena coming through the door and said, without any preamble, "You look terrible." "I know." "Is it over?" "Most of it." Yolanda looked at her for a long moment. "How much of the rest of it involves what I already know?" "Enough that you're going to hear things in the next hour that are going to be hard to process," Lena said. "I wanted to be here when you did." Yolanda didn't ask her to elaborate. She just nodded, the slow nod of someone storing that information and continuing to function, which was all anyone could do. The morning shift's charge nurse, a man named Barrett, who'd been working the day trauma floor for 6 years, came through the doors from the parking structure at that moment with his coffee and his bag and the expression of someone beginning an ordinary morning. He looked at Lena, who he knew as a night nurse, not a day nurse, and who was standing in the ER in yesterday's scrubs with mud on her shoes from a utility corridor in a transit station sub-basement, and said with reasonable accuracy, "Something happened." "Yes," she said. He waited. "The administrative office is going to contact you in about 30 minutes, she said. "There's going to be news about Dr. Halk that's going to affect this floor. I wanted you to hear it from someone who can answer some of your questions rather than just from the notification." Barrett set his coffee down on the nursing station counter. He crossed his arms. He looked at her the way people looked at you when they understood that what they were about to hear was something they were going to remember. "Tell me," he said. She told him. Not everything, not the classified portions, not the full operational detail, but the essential truth that Halke had been using his position and his administrative access to facilitate something criminal, that federal authorities had arrested him overnight, that his suspension was effective immediately. She said it plainly, without softening it into something easier to hear, because softening it wouldn't make it easier and would make it less true. Barrett was quiet for a long moment after she finished. 11 years, he said. Yes. He was my attending when I started here. She didn't say anything to that. There wasn't anything useful to say. And you, Barrett said, looking at her with a new configuration. The specific look of someone recalculating what they thought they knew. Who are you exactly? It was the same question Halk had asked her across Kessler's gurney, in a tone of professional challenge. Barrett asked it differently, genuinely, with the openness of someone who'd just had the ground shift under them and was trying to reorient. She thought about the answer. Someone who showed up, she said, same as always. Barrett looked at her for another second. Then he uncrossed his arms and picked up his coffee and said, in the voice of someone who'd decided to keep functioning, "You need to go home. You need a shower and 8 hours of sleep. I need to check on a patient transfer first, and then you go home." "And then I go home," she agreed. She was walking toward the documentation terminal when her phone buzzed again. Not a text this time, a call. A number she recognized because she'd dialed it herself 6 hours ago from this same nursing station. She answered. Marsh. The voice was not Pharaoh. It was older, with the particular quality of someone accustomed to speaking from a position of considerable authority. Not loudly, but with the assurance that the content of what they said would command attention regardless of volume. "This is Deputy Director Aldous Verne, Federal Chemical Threat Unit, Washington." She stopped walking. "I've been briefed on the overnight operation," Verne said. "I want to speak with you directly about several things, including the procurement network analysis and Kessler's recovery status. But the first thing I want to say is that what you did tonight, the identification, the treatment, the station operation, that's the kind of work that prevents a number that's very large and very permanent from appearing in a federal casualty report." She stood at the nursing station and looked at the trauma floor around her, at Barrett with his coffee, at Yolanda gathering her things to leave, at the morning shift nurses beginning their first checks, at the curtained bays where patients she'd never met were being tended by people she'd worked alongside for 3 years. And she listened to the deputy director of a federal unit she hadn't spoken to in 7 years tell her she'd done something that mattered. She waited for it to feel simple. It didn't. "Thank you," she said, because it was the true and appropriate response. "I'd like to discuss your availability going forward," Verne said. "Not a conversation for a phone call. In person, when you've had time to rest. Can we arrange that?" She looked at the nursing station, at the whiteboard with the patient roster, at her name in the scheduling column for the next 3 shifts. "I'll be available," she said carefully, "when the time is right." "Good." A pause. "One more thing. Kessler's handler reached us an hour ago with news about the encrypted files from his embedded period, the documentation he built over 9 months, the full procurement chain, the financial routing, the personnel connections, is intact and has been successfully recovered." "That's the foundation of the entire federal case," she said. "It is." Another pause, this one with a different weight. "His handler also passed along a message for you specifically. Kessler asked him to relay it when we confirmed your identity." She waited. "He said she was the right person in the right room." She stood with the phone at her ear and the morning shift of Harlow City General moving around her and that sentence in her ear. And she thought about a man on a gurney who had used the last functional breath his compromised body could manage to push 2 words out into the air of a trauma bay because he'd made a calculation, an assessment, the way people in their situations made assessments, that the person standing at the edge of the room, the one nobody was looking at, was the one who would understand what the words meant. He hadn't been wrong. She said goodbye to Verne. She put her phone in her pocket. She checked Kessler's transfer documentation. She spoke to the federal medical liaison about the monitoring parameters she'd written up, walked him through the clinical judgment points she wanted flagged, answered 2 specific questions he had about the atropine titration timeline. She did it with the care she brought to everything clinical, methodical, precise, not fast, but not slow. The pace of someone who understood that this particular work had consequences you couldn't undo. When she was done, she stood in the trauma bay doorway for a moment. Then she walked out of Harlow City General into the morning, where the city was fully awake now, and where somewhere in the federal processing system, 2 physicians who had spent their careers inside institutions that required an oath were beginning to understand the distance between where they were and where they had been. She had 1 block of walking behind her when her phone buzzed a 3rd time. A different number. Unknown. She stopped. She answered. Static. And then, with the slight distortion of a connection being routed through something that wasn't a standard cellular relay, a voice she didn't immediately recognize. Ms. Marsh. A woman. Careful diction, slight accent she couldn't place. My name is not important at this stage. What's important is that I'm aware of what you recovered last night, and I want you to understand that what Raymond Kessler documented represents approximately 30% of the network's operational structure. Lena stood on the sidewalk in the morning light. 30%. The remaining 70%, the woman continued, involves assets in 4 other cities, 2 foreign-based supply nodes, and a financing structure that neither Deputy Director Verne nor his team has visibility into. A pause. I have the rest of the documentation. I want to give it to the right person. Why me? Because Kessler trusted you, and because the people I'm afraid of already know I exist. Another pause. Shorter. I'm in Harlow City. I've been here for 3 days. I don't have 3 more days. Lena looked at the street around her, the ordinary morning, the delivery truck, the runner, the dog, and the woman with the focused disinterest. Where are you? She said. Don't move, Lena said. Give me an address. The woman gave it. A hotel on the east side, mid-range, the kind of place that had enough turnover to make a 3-day stay unremarkable. She gave a room number and then said, with the precision of someone who'd been calculating contingencies, Come alone. If I see federal vehicles, I leave. If I see anyone who looks like they're running security, I leave. I understand that's not a comfortable ask. It's not, Lena said. I know what I'm asking. I also know what I'm offering. A pause. Please. The last word landed differently from everything before it. Not calculated. Just a person, scared at the end of something long and exhausting, making a request. Lena stood on the sidewalk for 4 seconds. I need 30 minutes, she said. She called Pharaoh before she'd taken another step. The conversation with Pharaoh was short and not particularly comfortable, which Lena had anticipated. Pharaoh's position was logical. An unknown contact offering undocumented intelligence, requesting solo approach, was a situation with a recognizable risk profile. Lena's position was also logical, which was that the woman on the phone had used the phrase 30% with the specificity of someone who'd been inside the network. And that specificity didn't come from guessing. I'm not asking for authorization, Lena said. I'm asking for a passive perimeter. No visible presence, no vehicles on the block. If I'm not out in 90 minutes, you come in. Silence on the line. You understand that passive perimeter means we can't reach you fast if something goes wrong inside, Pharaoh said. I understand. Another silence, longer. 90 minutes, Pharaoh said. Not 91. Lena walked to the hotel. The room was on the 4th floor, east-facing, the curtains drawn. She knocked twice and waited, and the door opened on a woman who looked nothing like the voice had suggested. She'd been expecting someone who looked institutional, controlled, the physical presentation of someone embedded in a criminal network. What she found was a woman in her mid-40s who looked like she hadn't slept in several days, who was wearing clothes that had the slightly wrong fit of someone who'd purchased them in a hurry from a city she didn't know well, and who was holding a laptop to her chest the way people held things they couldn't afford to lose. Ms. Marsh, the woman said, you can call me Lena. She stepped inside. The room was sparse. A bag near the bathroom, a room service tray from what looked like yesterday, the curtains angled so that a thin line of morning light came in from one side without exposing the window. Careful habits. What do I call you? Nadia. Probably not her full name. Probably enough. How do you know Kessler? Nadia sat on the edge of the bed with the laptop still in her arms. He was my contact for the last 3 months. I was inside the network on the financing side, not embedded the way he was, just adjacent. I handled documentation for the foreign supply nodes. I didn't know what the materials were for until 6 weeks ago. What happened 6 weeks ago? I saw the Harlow City project file. Her voice was steady, but her hands weren't, the laptop shifting fractionally as she held it. I understood then. And I understood that the people I'd been working for didn't make a distinction between assets and liabilities. You reached out to Kessler. He was the only contact I trusted not to report back immediately. I gave him everything I had on the foreign nodes and the financing chain. He said he'd find a way to get it out. A pause. And then 4 days ago he disappeared, and I didn't know if he'd made it or if they'd gotten to him before he could pass anything on. He made it, Lena said. His documentation from the embedded period is intact and in federal hands. Nadia closed her eyes briefly. When she opened them, they were wet, but she didn't let it go further than that. The documentation he had covers the domestic procurement side. What I have, she lifted the laptop slightly, is the foreign supply chain, the financing nodes, and the identities of 3 individuals the federal team doesn't have names for. The ones who built the compound, the ones who would rebuild the delivery system in another city if this operation failed. Lena looked at the laptop. Why didn't you go directly to the federal team? Because I've been inside a criminal network for 18 months and I have no legal protection, and I have no guarantee that walking into a federal building with this material doesn't result in me being charged alongside the people I'm trying to expose. She looked at Lena with the directness of someone too tired for anything indirect. Kessler told me about you before he disappeared. He said if anything went wrong, there was a nurse in the ER at Harlow City General who would know what to do with the right information. He said you were the kind of person who made things land correctly. She'd never met Kessler before last night. He'd spent 9 months embedded in a network she hadn't known existed, in a city she'd been living in quietly, and at some point in those 9 months he'd identified her as a contingency. That was its own kind of thing to sit with. I can't promise you immunity, she said. That's not within my authority. What I can do is contact the federal team with you in the room, advocate for your cooperation status to be formally established before any information transfer, and ensure that your offer of material is documented as voluntary and proactive. She held Nadia's gaze. That's meaningful, legally. It's not a guarantee, but it's real. Nadia looked at her for a long moment. Kessler was right about you, she said. He doesn't know me. He knew enough. She set the laptop on the bed. Call your federal contact. I'll be here. Farrow arrived in 22 minutes with a federal counsel and a documentation agent, which told Lena that Farrow had anticipated this outcome and prepared for it before the 90-minute window had anywhere near elapsed. She didn't mention this. Farrow's preparation was not a thing to argue with. The next 2 hours were procedural and careful, and not particularly dramatic, the exact opposite of the night's operational hours. Nadia's cooperation status was established in writing before a single piece of information was formally transferred. The federal counsel reviewed the laptop's contents in general terms, confirmed the material's scope, and documented the voluntarily proactive nature of the disclosure. Nadia answered questions with the controlled precision of someone who had been rehearsing this conversation in her head for weeks and had decided, at whatever cost, to have it. What the laptop contained was what she'd said it contained. 3 names and their organizational roles in the network's foreign supply structure. Financial routing through 4 nodes, 2 of which connected to entities that Farrow, even with her operational experience, took a moment to process without visible reaction. And the synthesis documentation for the compound, not full technical specifications, but enough to identify the laboratory origin and the specific modification pathway, which meant that the CBRN technical team would be able to build a complete profile that could be matched against any future deployment. The network that had planted 4 devices in Vantage Station on a Tuesday night was not a local operation with local consequences. It had geography and money and technical capability that extended well beyond Harlow City, and what Nadia had on that laptop was the key to the part of it that Kessler's 9 months of embedded work had never been able to reach. Lena sat at the edge of that room and watched it unfold and understood, with the particular clarity of someone who'd been up for 26 hours and whose brain was running on something fumes adjacent, that the thing she'd set in motion at 11:47 the previous night was larger than she'd known when she set it in motion. That was frequently how it went. She left the hotel at 9:40 a.m. She went home, which was an apartment 8 blocks from the hospital, 3rd floor, with a window that faced west and therefore received no morning light. She had chosen it partly for that reason, 3 years ago, though she couldn't now fully reconstruct the logic. She showered. She ate something that required no preparation. She sat on the edge of her bed and looked at the floor with the specific quality of exhaustion that wasn't quite sleep and wasn't quite wakefulness, but was the body's intermediate state between the two. Her phone had 9 messages. She read the subject lines without opening them. Pharaoh, Vern, a number she didn't recognize. Yolanda, which she opened. Barrett told the morning staff about Halki. It was hard. Everyone is okay. Come back when you're ready and not a minute before. She set the phone down and lay back on her bed and was asleep in under 3 minutes. She slept for 9 hours and woke to the afternoon light going orange and the phone buzzing with a call she almost didn't answer. Pharaoh. The compound synthesis documentation from Nadia's material has been matched to a laboratory in Eastern Europe that Interpol has had under passive surveillance for 14 months, Pharaoh said, without preamble, because she had apparently assessed that Lena was the kind of person who preferred information to pleasantry. An international warrant package is in preparation. The 3 individuals named in the material are being located. Current intelligence suggests 2 are in country and 1 is in transit. Lena sat up, looked at the orange light on the wall. Kessler, she said, awake for most of the afternoon, communicating. His recovery is slower than we'd like, but within the expected range for the exposure duration. A pause. He asked about you. What did you tell him? That you were resting, which was accurate at the time. Something in Pharaoh's voice that was almost a thing you could call dry. He said to tell you the accounting is going to be a long one. I wasn't certain what that meant. She knew what it meant. It was a reference to the scope of the network, the 30% and the 70%, and the months of work that remained between what had been accomplished and what would constitute a complete accounting. It was Kessler, from his recovery bed, thinking forward, doing the work even now. Tell him I know, she said. She hung up and got dressed and walked to the hospital. The trauma floor at 6 p.m. had the particular quality of a space that had absorbed something significant and was still in the process of integrating it. She could feel it the moment she came through the doors. A slightly different atmospheric pressure to the ordinary routine, people moving through their tasks with the same competence as always, but with something additional underneath it. The thing that happened in a community when the person at the top turned out to have been something other than what they appeared. Barrett was at the nursing station. He looked at her when she came in and said nothing for a moment. Then, "You look slightly less terrible." "Slightly," she agreed. "The board chair was here this afternoon," he said. "The formal statement goes out tomorrow. Hulk's suspension is documented as immediate pending federal investigation. The medical board notification went out this morning." He paused. "I heard he tried to board a charter flight." "He did." "Where was he going?" "Somewhere that wasn't working out," she said. Barrett absorbed this. He had the look of a man who was rebuilding something in his understanding of the place he'd worked for 6 years, setting it on a different foundation, deciding whether the foundation held. "How much of what happened last night can you actually tell us?" "Some of it will become public as the case moves through the federal system. The parts that are classified will stay classified." She looked at the whiteboard, at the patient roster, at the familiar architecture of the floor. "What I can tell you is that everyone on this staff acted correctly last night. Yolanda, the residents, you. The protocols held, the floor held." Without knowing what the protocols were for, "That's usually how it works," she said. He was quiet for a moment. "What about you? What happens to you now?" It was the same question Pharaoh had asked in the staging vehicle, and she'd answered with, "I don't know." She still didn't know exactly, but she had a clearer sense of the shape of the answer than she'd had at 5 a.m. "I have some decisions to make," she said. "I'm going to take some time and make them." He nodded. Then he did something she hadn't expected. He reached across the counter and offered his hand. Not a formal gesture, just one person extending a hand to another in acknowledgement of something that didn't have a cleaner form of expression. She shook it. 3 weeks passed. The federal case against Preston Halk and Aaron Whitfield was formally filed in federal district court on a Tuesday morning, 14 days after the night at Vantage Station. The charges were conspiracy to deploy a chemical weapon, terrorism facilitation, attempted murder of a federal contractor, and obstruction of federal investigation. The filing was public, which meant it appeared in the news, which meant Harlow City spent a week processing the information that its most prestigious trauma physician had been using his hospital access to facilitate a domestic chemical terrorism operation. The Harlow City General Board convened an emergency session. The medical board opened a formal investigation. Halky's license was suspended pending the criminal proceeding, which was the procedural step prior to revocation, which was where it was going. Whitfield's privileges at Meridian Health were terminated. His own medical board proceeding began the same week. Neither of them was getting bail. The federal prosecutor had argued flight risk with one exhibit, a one-way charter ticket to a jurisdiction with no extradition treaty, and the judge had agreed. The public account of the Vantage Station operation, when it emerged, was accurate in its broad strokes and appropriately limited in its specifics. 4 chemical devices had been located and secured in a transit facility. A federal operation had prevented a mass casualty event that was projected to affect thousands of morning commuters. 2 domestic contacts had been arrested at the scene. The international components of the network were described as the subject of an ongoing multi-agency investigation. Lena's name did not appear in the public account. That was a deliberate choice, hers and the federal team's, for different reasons that reached the same conclusion. The case was stronger without a named individual at its center, and she was not someone who needed her name in a story to know what she had done. She knew that was sufficient. What did appear in the federal filings supporting documentation, the section that would become public record once the case moved to trial, was a reference to a critical field identification that had enabled the initial patient treatment and subsequent operational response. The documentation described the identifier as a former U.S. Army combat medic, currently employed as a registered nurse at Harlow City General. It described the identification of the compound, the treatment protocol, the intelligence assessment that had produced the Vantage Station location, and the sub-basement operation, in the precise, effectless language of legal documentation. When Yolanda read it, because Lena gave her a copy, because Yolanda had stayed 11 hours through the worst of it and deserved the full accounting, she read the whole thing twice without saying anything. Then she set it down on the break room table and looked at Lena. Former U.S. Army combat medic, she said. Yes. Currently employed as a registered nurse. Also yes. For 3 years. 3 years. Yolanda picked up her coffee, put it down without drinking it. You know what gets me? The part where Halky told you to go back to your medication prep. I went back to my medication prep. And then you saved everyone. Lena looked at the table. I did my job, both parts of it. Lena. Yolanda's voice had a quality she used rarely. Not gentle, not soft, but full in a way that made what she said land without cushioning. You were the most important person in that building for 6 hours, and nobody knew it except you. And you didn't. You didn't perform. You didn't make it about being seen. You just did what needed doing. That's the job. No, Yolanda said. That's character. Those are different things. Lena didn't have an answer for that. She sat with it instead, which was the appropriate response to something true that you hadn't found the words for yet. Raymond Kessler was transferred to a federal medical facility for the remainder of his recovery, which the clinical team projected at 6 to 8 weeks for the primary neurological effects and longer for the subtler damage that emerged gradually, the way the compound's more persistent effects surfaced in the quiet hours when the acute crisis had passed. He was going to be all right, in the imperfect sense of that phrase, functional, recovered, capable of the work he'd spent 9 months doing and intended to continue. There would be residual effects. He knew that and had filed it under the category of things that were true and non-negotiable. He sent her a message through Pharaoh's secure channel 3 weeks after the night at the hospital. It was short. You were right to make the call when you did. The atropine bought me enough time to know it was worth holding on. I want you to know that I knew that while it was happening. R. K. She read it 3 times. She saved it. She wrote back, "The accounting is going to be a long one." "I know. So is the recovery. Take the time." She didn't hear from him after that, which was correct. They were not people who kept in touch. They were people who had intersected at a point where the intersection mattered enormously and who would now return to their separate work. That was its own kind of relationship, particular and sufficient. Halt. The meeting with Deputy Director Verne happened 4 weeks after Vantage Station, in a federal building in the downtown district that looked like an insurance office from the outside, which was probably the point. Verne was in his 60s, compact, with the specific quality of someone who had spent a career in rooms where decisions had consequences and had become defined by that without becoming hardened by it. He stood when she came in, which she hadn't expected, and he shook her hand and said, "Sit down," with the directness of someone who didn't perform welcome, but meant it functionally. They talked for 2 hours. He told her what the international warrant process had produced. One of the 3 foreign contacts in custody, the other 2 located and in the process of being extracted through legal channels that were slow but real. The laboratory in Eastern Europe had been raided, the synthesis documentation seized. The financing nodes were being traced through a joint operation with 2 partner agencies. He told her that Kessler's embedded documentation, combined with Nadia's material, had given the federal case a scope and evidentiary depth that would support prosecution across multiple jurisdictions. That the people who had planned to release a modified chemical agent into a transit hub serving 80,000 daily commuters were going to face consequences that matched what they'd intended. He told her that Nadia's cooperation agreement had been formalized, that her legal exposure had been substantially reduced in recognition of the voluntary and proactive nature of her disclosure, that she was in a protection program and was doing, in Verne's words, as well as anyone does under those circumstances. And then he said what he'd actually asked her here to say. "We want you back," he said. It was simple. No performance. "Not in your former role? That was a different context and a different phase. We need someone who can work at the intersection of field medicine and chemical threat analysis. Someone who understands both sides well enough to operate in situations where the 2 aren't separable." "Like a trauma bay at 11:47 p.m., Shiki," she said. "Like that, yes." He looked at her steadily. "The position is civilian. Not a reinstatement, a new role, with a scope we're still defining because we've been operating without someone who fills it, and we keep discovering the gap." She looked at the wall behind him. A window, the city visible beyond it, the ordinary afternoon population of a city that 3 weeks ago had not known how close it had come to beginning a very different kind of Tuesday. "I've been a nurse for 7 years, she said. "I know. I'm a good nurse. I know that too. Those skills don't disappear if I take this position." Verne looked at her with an expression that reconfigured slightly. "No, we'd actually want to formalize your clinical background as part of the role. There are field situations, domestic response, embedded medical support, where that training is operationally relevant." "Both parts," she said. "Both parts," he confirmed. She thought about the trauma floor, about Barrett and Yolanda and the morning shift nurses and the residents who kept their heads down during hard calls, and the patients who came through the ambulance bay doors not knowing what they were bringing with them. She thought about what Yolanda had said in the break room, not performance, character. And she thought about the 7 years she'd spent building a life around one part of herself, while the other part waited with the particular patience of something that didn't go away just because you stopped looking at it. She thought about the moment in the sub-basement corridor, standing in the dark 4 feet from 2 men who didn't know she was there, with a backup device sitting on the floor, and Pharaoh trying to reach her on the radio, and the quality of stillness she'd been able to access. Not fearlessness, not invincibility, just the specific trained capacity to hold still and think when the situation required it. 7 years of hospital shifts had not built that. The hospital had given her something else: precision, patience, the ability to maintain care when the patient couldn't advocate for themselves, the understanding that medicine was not performed for the people in the room, but for the person on the table. That was real, and it was hers, and she wasn't leaving it behind. What she was deciding was whether she could hold both. She already knew the answer. She'd known it since the morning she walked out of Vantage Station into the gray-blue early light. "I'll need to formalize my nursing credentials continuity," she said. "I won't take a role that requires me to let them lapse." Vern made a note. "That's manageable. And I need 2 weeks before I start. There are things at the hospital that need a proper transition." 2 weeks, he said. "Done." She looked at him. "And the position title doesn't include the word analyst. I don't do reports. I do situations." Something moved across his face that was probably the closest he got to a smile. "Field coordinator, chemical threat response. That's what we have on paper." She stood and offered her hand. He shook it. Bet. Her last shift at Harlow City General was on a Thursday, 3 weeks later. She'd requested a regular shift. Not a ceremony, not a farewell event, just a shift like any other, because that was what the 3 years deserved. The floor didn't need a production. It needed her present and functional until the last hour, and then released cleanly, the way good things ended. She changed bandages and prepared medications and tracked vitals, and talked to patients with the same quality of attention she'd brought to every shift for 3 years. Not performing attentiveness, just being there, in the specific way that meant something to the person in the bed, even when they didn't have words for what it meant. She admitted a respiratory case at 4 p.m. She assisted with a laceration repair at 5. She handled a pediatric fever assessment at 6 that turned out to be unremarkable, and sent the parents home with the kind of calm, specific instructions that actually answered their questions rather than just reassuring them. At 7 p.m., Barrett came to find her. The charge desk was quiet for the moment, that brief interval between the evening admission wave and the night shift settling in period. Barrett had a cup of coffee and the expression of someone who decided to say a thing and was going to say it. "I've been trying to figure out what to tell you," he said. "Something that covers it." "You don't have to cover it." "I know. I want to." He looked at the floor for a moment, then back at her. "When I started here, Hulk was the one who told me that the job was to be the best person in the room when it counted. He said it like he meant it. I believed him for 6 years." A pause. "Turns out he was describing you." She looked at him for a moment. "He wasn't describing anyone. He was performing." "Yeah." Barrett nodded. "And you weren't. That's the whole thing, isn't it?" She didn't answer, because the answer was self-evident, and he knew it. Yolanda appeared at the end of the hallway, off shift, but still in the building, with the deliberate casualness of someone who had timed their departure to coincide with a specific moment. She walked over and stood beside Barrett and looked at Lena with the expression of a woman who had 19 years of nursing and a full accounting of the last month behind her eyes, and was not going to manage this moment by being anything other than direct. "The floor's going to be fine," Yolanda said. "We were fine before we knew who you were, and we'll be fine after you go." "I know. But the knowing makes a difference." She reached out and touched Lena's arm briefly. Not a hug, not a ceremony, just contact. "Take care of yourself out there." "I intend to." "And if you ever need a nurse," Yolanda said, with the deadpan precision she deployed when she was saying something she actually meant, "you know where to find one." Lena looked at her. "I might." She finished her shift at 7:30 and changed and walked out through the ambulance bay. The same bay where the gurney had come through 6 weeks ago at 11:47 p.m., where she'd stood with a medication tray and smelled something that reordered everything. The bay was ordinary. A paramedic crew was doing a post-run restock. The automatic doors were cycling. The city outside was running its evening business, with the comfortable indifference of a city that didn't know and didn't need to know what had been held back on its behalf. She walked through the doors. There was something Lena Marsh understood about herself that she hadn't fully articulated until she was standing on the sidewalk outside the hospital at 7:35 p.m. on a Thursday, with a career behind her and a different one beginning in 2 weeks, and the evening air doing what evening air did in Harlow City in this season. Carrying the particular combination of cold and industrial residue and something underneath that might have been the river 2 miles west. She had spent 7 years trying to be invisible. Not out of shame. She wasn't ashamed of what she'd done or who she'd been, but out of a genuine belief that the quieter life was the right one for where she was. That she had given what she'd had to give in the context that had required it, and that the next phase was supposed to look different, smaller, more contained. What she hadn't understood was that invisible wasn't the same as small, that the quiet years on the trauma floor had not been a retreat from who she was, but an accumulation of something else: clinical patience, institutional knowledge, the specific intelligence that came from working inside a system for long enough to know where it was strong and where it broke. She had not been waiting to be reactivated. She had been becoming something that hadn't existed before. Both parts: the medic and the nurse, the operator and the caregiver, the person who could stand in a dark corridor and hold still, and the person who could sit beside a patient and be present with them in their fear without making it about anything other than them. She was not a weapon waiting to be picked up. She was not a dormant asset. She was a person who had learned two difficult things fully and carried both of them, and the night at Vantage Station had not revealed her. It had used her correctly, which was different. What she knew, what she was walking away from the hospital carrying, alongside the ordinary contents of her bag, was that the places where she was most likely to matter were the places where those two things intersected, where the clinical and the tactical were not separate skills but a single capacity, where knowing how the human body failed under specific conditions was the same knowledge as knowing how to prevent the conditions. The federal role would take her to those places. She was ready for it, imperfectly, the way you were ready for the things that were actually worth doing. She turned left on the sidewalk and walked toward home through the early evening of a city that was alive and intact and entirely unaware of the specific chain of decisions that had preserved it. That was how it was supposed to work. The city didn't owe her its awareness. She hadn't done it for the awareness. She'd done it because she was in the right room and she knew what she was looking at. She'd done it because that was what the moment required. And she had learned, in 7 years of nursing and in the longer years before that the moments that required the most were not the ones that announced themselves with urgency and spectacle. They were the ones that arrived quietly, in the middle of a night shift, in the door of a trauma bay, in the smell of something that didn't belong. And the only question they asked was whether you were paying attention. She had been. She always had been. The city moved around her indifferent and alive, and Lena Marsh walked home through it with the particular steadiness of someone who knew exactly what they carried and had decided, finally, to stop pretending it was less than it was.